Okay, let's go to 589, and Dr. Kerwin, Mary Pouton, and Dr. Reese, or Mr. Reese, please come forward. Call his staff so they can jump in. We have a little scheduling situation, so we're going to start with 589. Then we'll go to the Senate President's Bill and related to Morgan. Welcome to Education, Health, and Environmental Affairs. We do require masks in the audience and at the witness table. We have a number of bills today, so we are going to move in as expeditious a process as we can. 589 is University of Maryland Employees Authorization to Fundraise. We're joined by an esteemed panel led by Dr. Britt Kiwan. Welcome back, Dr. Kiwan. We'll have their staff jump. Senator Hayes became a father a couple days ago, so he's at home, so his chief of staff will be here momentarily, but we're going to begin. Dr. Kiwan.
Thank you very much. Al, you want to start? I think Dr. Reese will start.
Dr. Reese, I apologize.
Thank you, Mr. Chairman. Thank you very much. I extend my congratulations as an obstetrician to Senator Hayes on his recent new baby. Well, it's a pleasure for us to be here and a privilege. For the record, I am Dr. E. Albert Reese. I'm the Executive Vice President of the University of Maryland, Baltimore, and Dean of the School of Medicine. As you know, the School of Medicine and the University of Maryland Medical Center are linked together in law. In 1984, the Maryland General Assembly passed legislation that created the University of Maryland Medical System Corporation as a separate entity from the University of Maryland, Baltimore. They did so while assuring a compatible and mutually beneficial relationship with the university. In particular, the law requires the University of Maryland Medical Center to coordinate with the university fundraising efforts, including all medical system corporation campaigns, solicitations for private gifts and proposals for both private and federal grants. However, under the provisions article, this is Section 5505 and Section 5506 of the state ethics law, the University of Maryland, Baltimore employees are not allowed to solicit private gifts and proposals on behalf of a private nonprofit entity such as the University of Maryland Medical Center. The University of Maryland, Baltimore is now seeking today an exemption to Section 5505 and 5506 of the state ethics law in the general provisions article. This exemption that we now seek will allow the university employees to work as fundraisers seeking support for projects for both the university and the Medical System Corporation. In the academic medical center fundraising world, both the medical school and the hospitals are increasingly working collaboratively and in a fundraising model, in a joint fundraising model. This exemption that we're now seeking would align with the current best practices and grateful patient fundraising and will position major gift officers to work together and more collaboratively with grateful patients on behalf of both the hospital and the medical school. In March last year, 2021, I asked Chancellor Kiwan, who is both a member of the University of Maryland Medical Center Board and the University of Maryland School of Medicine Board of Visitors, to lead a task force along with a consulting firm to explore best practices of like institutions across the country. Mr. Chairman, the report was most compelling and indeed is a catalyst for our request before you today. At this time, I'd like to ask Chancellor Kiwan to briefly explain the results of the task force that was presented to me at the time. Thank you.
Thank you, Dr. Reese. Dr. Britt Kiwan, who everyone is familiar with. Welcome, Britt.
Thank you very much, Chairman and members of the committee. I appreciate this opportunity to say a few words this morning. Let me say at the outset, we completely understand the rationale for the law that we're asking an exemption from. And the reason we're asking for an exemption is because of the unique relationship between the School of Medicine and the hospital. It's important for you to understand that every doctor that practices in the hospital is a member of the School of Medicine's faculty. So you can see that the intertwine between the School of Medicine, which is a state entity, and the hospital, which is a state-supported but non-state, not-for-profit, has a very special and unbreakable relationship. So as the dean mentioned, he asked me to conduct this study on behalf of the School of Medicine. And so what we did is we took 8 major academic public medical centers, and we took places where the School of Medicine and the hospital were reported to do different boards. In all 8 of these cases, they had joint fundraising. So they raised money together for the hospital and the School of Medicine jointly, which we can't do. And the results of that study are quite dramatic. We found that we raise $40 million less than the average of these 8 medical schools. $40 million less left on the table for our School of Medicine. So why is this? Why are we raising less money? Well, it's because of this artificial separation between the fundraising efforts of the School of Medicine and the hospital. First, I think you could see that because they're independent, there's a duplication of effort. There's a duplication of grant accounting, communications, event planning, all in separate operations. So there is an inefficiency in the use of resources. But here's an example that drives home the problem we face. Let's suppose we have one of our doctors at the hospital, a member of the faculty in the School of Medicine, and they know that there's a piece of equipment out there that would make an important difference in their delivery of health care, how they would treat their patients. And so this doctor goes to the fundraiser, a development officer in his department, or her department, and says, could you help me raise money for this piece of equipment? And the development officer would have to shake her head or his head and say, I'd love to, but I can't, because the equipment will be in the hospital. It won't be in the School of Medicine. And the development officer might say, well, let me try to get hold of a fundraiser in the hospital and see if they could help. And you go to the fundraiser, and she calls the fundraiser in the hospital, and they say, oh, I'd love to, but I've got another project I'm working on right now. So I think you can see the complication this creates. Now,
Dr. Kerwin, we're going to have to move on to...
Okay, I understand, but I'll just close by making this point, which I think is so important. Think about this $40 million that isn't coming into the School of Medicine and the hospital. This is not for the benefit of the hospital. This is so we have better health care. So we're missing out on an opportunity to improve health care for the citizens of Baltimore and our state. Thank you very much.
Thank you, Dr. Kerwin. Ms. Pouton.
Yes, thank you for,
after your presentation.
okay, sounds great. I'll be very
There's
short
no
and
one
sweet.
signed up in opposition for oral testimony.
Okay, I'll be very short and sweet. As you know, Dr. Kerwin just gave an impassioned plea. I'm the Associate Dean for Development at the School of Medicine, and I've been here over 16 years, and I've lived this situation of inefficiency in fundraising. And I would just like to say that this inefficiency allows getting in way of unified joint fundraising as well as big vision ideas. And if we were able to follow this model, as Dr. Britt Kiwan said, we would be a lot more efficient in our fundraising and be more robust and really make a lot of difference for our research and our patient care for the School of Medicine and the hospital system in which we are jointly combined. Thank you.
Thank you all very much. We'll take a few questions, then we'll move on to the Senate President's bill, which is next. Senator Carosa.
Thank you, Mr. Chair, and thank you for the presentation. And Dr. Kerwin, you might recall we worked together when you were at Ohio State University and I was working for Congressman Hobson at the time.
Absolutely.
You caught my attention on your chart, leaving money on the table.
Right.
And of course, I saw that Ohio State University had the model and was at the top.
Right.
But were you, beyond Ohio State University, which is listed at the top, did you talk to these other universities to have a sense that they are doing so much better in fundraising than we are doing now?
I did.
Did you surveyed them?
Right, we talked to University of Pittsburgh, University of Wisconsin.
Going into the.
Oh, I'm sorry, yes.
It's being
yeah.
streamed, so we want to
Yes,
make sure people know.
we talked to University of Wisconsin, University of Pittsburgh,
In Nebraska.
and the University of Nebraska, all of which have this joint fundraising effort for the School of Medicine and the hospital. And, you know, sadly, we're looking for candidates to replace this remarkable man on my left. And I've had a chance to interview some of the candidates, and I've asked them about this joint fundraising and said what they thought about it. And they say, well, of course, isn't that the way you're supposed to do it? So it's not, it's the way it is happening at the other major medical centers, and we're missing out on something that, again, would improve health care for the citizens of our
And I
community.
knew of Ohio State's
Right.
success, but I just wanted to know that the
Right.
others were
There are
surveyed
others,
as well.
yeah.
Thank you.
Okay.
Senator Lamb.
Yeah, thank you, Mr. Chairman. And Dean Reese, good to see you again. So as a proud alum of UMB, always want to see what we can do to help our state institutions and appreciate you being here. And this arrangement, just to be clear, is not unusual where we have faculty who are at the School of Medicine who practice, for example, at the hospital or the health system, the medical system, are also faculty at UMB. And so this collaboration, this synergy is not uncommon in many ways. It sounds like it's something that these arrangements are pretty normal for places that have both a hospital health system attached to an academic institution, right?
That is absolutely true. That's as Chancellor Kerwin said, that's the way it works. In fact, I have been at private institutions and other institutions, so when I came here, I just assumed that this is the way it would have worked, until I was told that, no, you can't do it that way. So it is quite commonplace, as was described.
And I think in the written testimony, just to remind the committee, there's a list, I think, of about 25 other institutions that are
it this way.
that have a similar ability to be able to do this, and that's kind of what you're seeking too. A lot of peer institutions like University of Virginia, University of Michigan, University of North Carolina, Texas, Minnesota, et cetera. So it's not, go ahead.
Senator Lamb, if I could make one other point. The General Assembly was wise to invest over $100 million recently to build a new home for the Greenenbaum Cancer Center, which will be an addition to the hospital, the university's hospital. Now, wouldn't it be wonderful if the fundraisers in the School of Medicine could help raise money to put equipment in that building? The state has invested $100 million in that building. We want to help equip that building with the best state-of-the-art equipment possible.
And this allows for that synergy.
That
too.
would allow this to happen.
Well, thank you. And Dean Reese, I don't know if this will be the last time you're here before the committee, but thank you for your service to the state. You came in after I started medical school there, and so I saw Dean Wilson before, but now I've seen your tenure there. Certainly appreciate everything you've done, and we'll miss your leadership there at the School of Medicine.
Well, it was nice that you graduated on my watch, though. And it'll be 16 years, and it's time to pass the baton to somebody else.
Time flies by, huh?
So thank you very much for all you've done, and you've made us proud.
Thank you.
Yes, clearly your student has excelled in public health for the state, higher ed institutions, as well as here in the Senate. So thank you all.
Thank you.
For your testimony. Thank you very much for joining us today and sharing this important issue with us.
Thank you.
Thank you. Okay, we're going to move to Senate Bill 841, Senator Ferguson and Morgan State President David Wilson. If the two of you could please come forward, we'd appreciate it. Welcome, Mr. Senate President. Oh, they are joined by the former chair of the Education, Health, and Environmental Affairs Committee, Joan Carter Conway. Welcome back, Madam Chairman.
Thank you. It is wonderful to be back in a prior stomping grounds. In fact, I think it was with the chair and Senator Riley, Senator Simon Ayer. We spent many a long hour together in this room. Many a long hour. It was where we cut our teeth to move forward. Mr. Chairman, Madam Vice Chair, members of the Education, Health, Environmental Affairs Committee, it's truly a pleasure to be back here with you all and presenting a bill on behalf of Morgan State University. Look, this committee knows full well the incredible asset that is Morgan State. Some of the details of Morgan State's history maybe are less well known, particularly as we look at its research status. It was back in 2008 or 2006, I'm sorry, is when Morgan initially reached R3 status. And this is the Carnegie classification that sets the tiering for universities across the country and globally. So in 2006, Morgan State reached R3. It was 12 years later, in 2018, that Morgan moved to R2 category, so moving up the research ladder, largely as a result of the incredible work of President David Wilson, who has really just set forth an incredible vision and executed on it consistently. So where are we now? Now we're at a place where we're about to make, or in this year, are making historic investments in our historically black colleges and universities. And Morgan State is on the precipice of launching its next 10-year strategic plan. So the bill that you have in front of you redefines and adds to the intent of Morgan State University to ensure that we are putting the state's emphasis and clout behind ensuring that Morgan can become one of the very few and would be the first historically black college and university to reach R1 status, meaning that there would be greater access to research dollars, greater prestige, the ability to attract the best possible faculty who are looking across the globe at where they're going to take their talents. And so this is a intent bill that has a practical impact of demonstrating the state's commitment to helping Morgan State to have the resources and focus needed in order to move it into this elite status that we now have only 3 of our universities at the moment in the state of Maryland, one being Hopkins, College Park, and just this past year, UMBC. And so certainly the progress that we have seen and the momentum from 2006 is not just obvious, it is incredibly commended. Now it's time to take it to the next level, because at the end of the day, Maryland's greatest asset, the thing that defines us, that makes us better than most, is our investment in our higher education system. It is our defining characteristic, and Morgan State is an absolutely essential partner, and we should be doing whatever we can to make sure that we are supporting their efforts to reach that highest level. With that, I would like to hand it over to President Wilson, Mr. Chairman.
Dr. Wilson, please.
Thank you very much, Chair Pinsky. And first of all, thank you to Senate President Ferguson for sponsoring this bill, and to the other members of the committee. We indeed are honored to come and really testify very strongly in support of Senate Bill 0841, sponsored by Senate President Ferguson. Really, I should just say ditto to everything that President Ferguson said, if you will. But there are 146 R1 very high research institutions in the United States as of January 31st, 2022. And there is no HBCU in that group, and there has been no HBCU in that group since the Carnegie classifications actually modified its ratings in the late 1990s. And I have been very, very public about this. It's time for that to change. We have at Morgan an institution that is indeed quite poised to move to this penthouse level of very high research activity. You have designated us as this state's, quote, preeminent public urban research institution. And so we are the only public comprehensive doctoral research university in Baltimore City. And we have taken that destination quite seriously. And as a result, we are populating our faculties with an understanding that we are raising our hands and we are taking on some of the intractable opportunities that we see in our marginalized communities and in our urban spaces. And so as we seek to conduct this research, the evidence-based approach, we are doing it with an intent to move that research away from the campus and to put it in the hands of individuals who know what to do with it on Monday morning in order to address some of these urban conditions. With that in mind, we know with certainty that what we are ascending to at Morgan and embracing is not duplicative of any of the R1 institutions, indeed any other institution in this state. It would be a very, very unique mission and a very unique role. And so I am really quite honored to sit here in support of this bill, and should the Maryland legislature pass this bill, it would be historic. It would be the first time in the history of America that a state legislature has said that one of its historic HBCUs should also be in the highest research category of higher education in this nation. And so we thank you very much.
Thank you, President. Senator Carter Conway?
No, Mr. Chairman, I'm merely here for questions only. I would just like to take this opportunity to thank you for your gracious introduction, and I love it at this end of the table.
So do I.
Well, committee, before I entertain questions, you know, a couple of weeks ago, the Washington Post ran an article about HBCUs. And they highlighted this great institution, Morgan State. And I just want to mention a couple of factors to you. 70% of the students are returning after their first year. You know, a lot of students we know at whatever campus, they try it, it's not for them, and they say thank you, but no thank you. But in addition, and this is pretty crucial, when Dr. Wilson arrived in 2010, 29% of the students graduated within 6 years. It's graduate. That's what they use federally for a graduation metric. Now 44% do. I mean, think about that, from 29 to 44%. That's magnificent. You know, and at least in the DC area, Howard University gets a lot of press, and we know they pulled a few very famous people to teach there. I have to tell you, Morgan State University is moving up very, very rapidly, and I think this proposal before us will help meet or exceed what Howard does. It's becoming a place where a lot of people want to go, and some HBCUs unfortunately have lost enrollment, but it's gone up. Is it 9%, Dr. Wilson?
Yes, yeah, we have the largest enrollment in the 154-year history of Morgan, and we had the largest freshman class in our 154-year history. We had a 100% increase in our freshman class over fall of 2020, fall of 2020, and our enrollment right now is marching toward 9,000 students.
Great. Well, thank you for all of that.
But we have 12,000 applications.
You know, we want it to be competitive. We want you to attract the best of the best and help our state. I think I had Senator Riley, Senator Ellis, Senator Carosa in that order.
Doctor, just to let you know, my son-in-law has an R1 that he got at the University of Virginia, $4 million research study in the area of kinesiology, and he was able to transfer it to Rutgers, where he is now for the past 2 years. Don't forget transfer research programs. I'm very supportive of the program. You can count on my vote.
Yes, and I was vice provost at Rutgers under late President Blaustein, and was a part of the whole effort there to actually elevate Rutgers because it was sick and tired of being in the shadows of Princeton. And so I do understand that approach and embrace it.
Thank you. Senator Ellis?
Thank you, Mr. Chairman, and Mr. President, and Madam Chair, thank you for this bill. I apologize, I have to leave right after I ask this question because I have to go to the Chairman's Committee over there for a bill hearing. But I just want to say congratulations, Dr. Wilson, all you've done. And I just want to ask, I noticed the fiscal summary on this bill. There is no additional monies coming to this. So what will this bill do to get you within those ranges for the R status you desire? I know it's about $50 to $70 million.
Yes, and so, yeah, absolutely. So it would actually elevate Morgan to be under more serious consideration for multi-year federal grants because the state would have made a statement about its intentions in elevating this institution to the highest research ranks. And so we would expect to see more multi-year federal grants from DOD, from the Department of Defense, from many of the other federal agencies. And there's a kind of a pecking order that's unstated with regard to how these institutions are ultimately winning the grants. And it has to do with what kind of perspective the reviewers have about the institutions in which they are reviewing. And so certainly this is going to go a long way, we think, in creating a level playing field and a level of objectivity to the review process for Morgan State University, and consequently increase our overall federal grants.
Yeah, thank you for that. And one quick last question. Are you able to use the monies from the HBCU settlement which came through? Is that flowing through Morgan? Have you seen an effect on that yet on your campus?
We will get our first appropriation this year, $15.1 million, and we have already identified the unique high-demand programs that we will be investing that money in, some new and some existing that we have to shore up. We will have to also use some of it to reduce our faculty workload, so we have the highest faculty workload in the state at about 4-4, meaning our faculty are teaching on average 4 courses in the fall, 4 courses in the spring. If you compare that with the other R1 institutions, it may be 2-2 or 2-1. And that is freeing them up more to be competitive in the grant space. And so we are using those funds in a very strategic way in order to position the institution in the way in which our next 10-year plan is directing us to.
Yeah, thank you, Mr. President. I want to thank this president here first for your leadership in making sure that HBCU settlement went through. So really, a lot of appreciation. Thank you.
Senator of Maryland.
Senator Carosa, followed by Senator Patterson.
Thank you, Mr. Chair. Mr. Senate President, Dr. Wilson, Madam Former Chair, thank you for this legislation. Last week, our colleague, Senator Sidnor, spoke eloquently on the floor about the historically black colleges and universities in Maryland. And I'm very proud to represent UMES. And I've really learned from his comments the special relationship between Morgan and UMES. And as a matter of fact, I asked for a copy of his speech, and I've already used it in some of my comments. Really appreciate those partnerships, especially my president, UMES, Dr. Heidi Anderson, really understands the community partnerships with the HCBUs. So I wanted to let you know I was aware of that relationship between Morgan and UMES. My question is, I really honed in on your comments, Dr. Wilson, when you said that this research could be used outside of academia, that you were taking this research and putting it into where it counts, in the neighborhoods, in the communities. Could you go into a little bit more detail?
Yes. So in order not to make this academic at all, we certainly will be focusing disproportionately on what we call applied research, meaning that we are taking on issues where the results of the research will be placed in the hands of policymakers and others, and they can know what to do with this if, for example, we want to implement programs in order to address whatever the challenges are that we are seeing in these environments. For example, one of the areas that we are seeing rising quite rapidly is what we are calling bias in artificial intelligence machine learning that is being built into these algorithms. As a result of the kind of implicit bias that we all have, when you build these systems, they are basically going to mirror, if you will, the individuals who build them. And there is serious negative implications there for urban populations and for marginalized populations. And so what Morgan is doing in this space, and we're using some of the funds that we received from the settlement, is to create a national center for equitable AI machine learning. And we are going to basically do the research to say, if indeed you want to develop these kind of algorithms, then here's how you need to do that, and here are the policies that you need to put in place to ensure that that bias is not baked in. So it's this kind of practical application of the research that we'll have as one of our primary foci.
Thank you.
Patterson, please.
Thank you, Mr. Chair, and Mr. President, and former Chair. Thank all of you for being here this afternoon. And just a quick question I want to follow up on in terms of the scope of the research activities that might take place at Morgan State. I'm going to move away from Morgan just a little bit to try to get a little feel as to how you, and if you see any possibility of developing any type of partnerships with, let's say, UMES, who is an 1890 land grant institution, and University of Maryland, of course, is 62. I'll be curious to know if you see any possibilities there. And lastly, if you could just briefly talk just a bit about your overall endowment at the institution, since that sort of dictate and lead the way for major corporations to come to the table with monies.
All right. And so, first, absolutely, we see an opportunity here to deepen our partnerships with UMES. As you heard, UMES actually started as Princess Anne Academy, a branch campus of Morgan State University. And so we have a very, very special, respectful, deep relationship. And President Anderson and I work extraordinarily well together. And we are not the land grant institution, but UMES is the 1890 land grant.
Right.
And we do see opportunities there in things like urban gardening, urban farming, in order to ensure that we are working in our urban space, but we are partnering with a place like UMES to bring their expertise. The second has to do with the endowment. And so to put this in context, just in terms of point of departure, when I arrived at Morgan in 2010, our endowment was $14 million. And as of the last reporting, it's around $120 million. And so that, of course, was advanced significantly with the $40 million gift that we received from Ms. Mackenzie Scott, and then another $20 million private gift from Morgan alum Calvin Tyler and his wife Tina, and then we've really ratcheted up our investment in our institutional advancement area, and have as a goal over the next 10 years to grow our endowment to at least $500 million. And that still is just a drop in the bucket,
Sure.
if you will. So we do see this opportunity, and I realize we're in the public space, but we have just a incredible number of partnerships with Johns Hopkins University. Indeed, the AAU, which is the absolute elite group of 66 universities in the country, invited President Daniels and myself to present to 58 of their presidents in October because of these deep relationships that we have there. And so those are relationships that will continue to grow. And also, as Senate President Ferguson indicated, they are going to lead to even our being in a position to win many more multi-year federal grants.
Good. Thank you. Thank you, Mr. Chair.
Thank you, Dr. Wilson. Thank you, Senate President. Thank you, Senator Carter Conway. Seeing no further questions and no oral opposition, that concludes the hearing on this bill. We're going to shift to Senate
Thank you all.
Chair Gazzoni. He has two bills. Please come forward, Senator.
Thank you, Mr. Chair. If I could,
Senator Gazzoni, if we can bring up Robert Orr, who I saw in the back row there, and Nina Harris to join you up front. And the first bill is going to be Senate Bill 595, University of Maryland Institute for Public Leadership Establishment. If you all want to take a seat, just we try to do social distancing, so you can sit there or you can sit in the front row as you like. Senator Gazzoni, welcome back to EHE.
well, it's good to be here. I don't think it's lost on anybody sitting here, because we are all leaders in various ways, shapes, and forms, that leadership matters. And serving as we do, we know it is a privilege. But what I think we've come to find out, maybe in the world a bit, is that we need to make sure that the ability to lead, the ability for people who want to lead, that they should have skills that they can be taught, and that it should be accessible to everyone. Removing the barriers to accessing public leadership careers, supporting underrepresented and underserved groups to develop the skills and networks that open up opportunities to lead and serve is critically important as we move forward in society. And that's what this bill does, or helps to do. The Institute for Public Leadership, which we're located at the University of Maryland School of Public Policy, which I'm happy to say I'm a graduate of, will take on the responsibility of building a skilled and diverse pipeline of leaders by providing students with experiential learning programs, internships, mentorships, networking, and professional development. You know, I remember when I was there, and of course I picked up, I hope, a few leadership skills before this institute was formed. But the reality is that we want lots of people from diverse backgrounds to be able to pick up those leadership skills and to understand what it means to lead, and the challenges and the benefits of it. So that's essentially what this does. It creates a mandate for funding of this institute based at College Park in the School of Public Policy. And from there, I'm just going to allow my panel to go forward.
Good for you for finishing your public policy degree. As Dr. Orr knows, I have 75% of an MPP, which doesn't quite count for much. You get up to 5 minutes as the lead witness, and welcome to Education, Health, and Environmental Affairs.
Thank you very much, Madam Chair, members of the committee, and Chairman Gazzone. It is a great pleasure to be with you here this afternoon. My name is Bob Orr. I am the Dean of the School of Public Policy at the University of Maryland. As Dean and as a public servant for many years, I am proud of the top quality public service education we provide and the distinguished public leaders we produce every year, including some of you here at this table. While at the same time, I am deeply humbled by the overwhelming need and demand for public leadership education that far outstrip our current capacities. At this moment, when the need for public leadership is greatest, the high calling of public service is being drowned out both by attacks on the public trust and by the opportunities available in the private sector. Our students remain tenaciously idealistic, and we are seeing very strong demand for careers advancing the public good. But people are increasingly choosing pathways outside of public service. That is why your support for the Maryland Institute for Public Leadership is both timely and consequential. The Institute will strengthen the pathway into public leadership as an accessible opportunity worthy of pursuit by our best and brightest from all backgrounds and all walks of life. As effective public leadership education relies on robust, hands-on learning, including bringing students to Annapolis and bringing practitioners to students, the infrastructure of an institute will be critical to scaling the opportunities to meet this burgeoning demand. The Institute for Public Leadership will enhance our ability to expand the pipeline of diverse, effective public leaders to serve the state both locally and nationally. We are grateful for your consideration of this legislation, and we urge a favorable report. Thank you very much, Madam Chair.
Yes.
Great. Thank you. Good afternoon, Madam Chairperson and members of the committee. Thank you for the opportunity to testify before you today in support of this bill. I'm the Associate Dean for Academic and Student Affairs at the University of Maryland School of Public Policy, and I have witnessed firsthand the benefits of a multitude of leadership programs based in institutions of higher education. For 30-plus years, I have taught numerous leadership courses and have developed and delivered several leadership programs for undergraduates, graduate students, and public officials. An Institute for Public Leadership serving both current and future leaders in Maryland will build upon the long history of similar work within our school. We are uniquely qualified and positioned to launch the Institute for Public Leadership at the University of Maryland. Our experience in developing and offering top-notch leadership programs and courses spans decades and began in 1987 with the Center for Political Leadership and Participation, an institute with the primary focus of developing young people, people of color, women, community leaders, and political leaders. The range of our leadership programs has long and deep ties worldwide. In the classroom, we have taught thousands of students in our graduate, undergraduate, and executive programs in the art and science of leadership. The foundation of this coursework, then and now, has a heavy emphasis on developing leaders for a pluralistic society. Because of the demonstrated interest and demand in our leadership programs, in 2006, we launched the Rawlings Public Leadership Center as a living legacy to Delegate Howard Peters Rawlings. The center's mission was to foster public leadership in Maryland with special attention to those historically underrepresented in public life. Public leaders were selected from a pool of distinguished, elected, appointed business and nonprofit leaders in Maryland, many of whom you all know and have had the pleasure of working with. Promising Maryland undergraduate students also participated in a rigorous leadership development program. The Rawlings Undergraduate Leadership Fellows Program continues to thrive after 17 years.
Thank you.
Thank you.
Thank you so much for the testimony. I am looking to see, I see no colleagues with questions, so I will ask either the sponsor or either Dean. Can you talk about and can you take this opportunity to brag about one of the very coolest things about the University of Maryland, which is Do Good? And can you talk about how this new program would collaborate with that?
Thank you very much, Madam Chair. The Do Good Institute that was founded at the University of Maryland just 5 years ago is producing academic programming for leadership in the philanthropy and nonprofit sectors unparalleled in the entire country. We are attracting and producing the leadership of nonprofits throughout the state and around the country, as well as populating the very important players in the public space of philanthropies. This Public Leadership Institute is to make sure we are able to maintain a balance and attract people who want to serve the public good in the roles that people like you play every day, not just in the philanthropic and the nonprofit sector. Obviously, advancing the public good requires leadership in the public sphere, in the nonprofit sphere, and the private sphere. This institute will help us not only complement the amazing progress and programs through the Do Good Institute and the School of Public Policy, but it will also ensure that that ecosystem of public leadership remains well led by people from all backgrounds.
Anything you'd like to add?
Yes, so what we've done also that connects to the Do Good Institute and leadership sphere is we've launched an undergraduate minor in nonprofit leadership and management. It's become, in the last 3 years, one of our most popular minors on campus. We have several courses that are not just offered in the School of Public Policy, but also on campus. We've kind of integrated the notion of doing good across campus in a lot of academic spaces, and it's become very, very popular. So expanding and connecting the leadership piece through our Do Good efforts has always been the intent. So.
That's fantastic. Just in case anyone's listening here or listening at home, the Do Good 10th anniversary Do Good Challenge T-shirt design contest is going on now. So if you've got some arts or graphics skills, the submission deadline is coming up next week. So check that out on their website. I see no other questions, so thank you, Senate Chair Gazzoni. Thank you to both deans for all you do and for joining us today. That completes the hearing on Senate Bill 595. The next bill is also by Chair Gazzoni, and that bill is Senate Bill 802, Maryland Consortium on Coordinated Community Supports, Membership and Coordinated Community Supports Partnership Fund revisions. Mr. Chairman, and if you'd like to bring up.
I would love to.
Chair Casemeyer, we have a lot of chairs in here
Yeah, we're
today.
very, very lucky.
Yeah,
Very lucky today.
and Jill Bonenkamp, and Mark Luckner is here as well. So if you all want, if one of you wants to sit in the front row, if you want to socially distance, or if you're fine there, either way is fine. Mr. Chairman, current chair.
Right. A little tricky, huh? Look, this committee clearly was the epicenter of the Kerwin, of the blueprint. You guys know it better than anybody. And one of what I consider probably the most significant components of it was the consortium, which is, of course, focused on behavioral health issues for our students. And if they're, as you know, we hear it every day, how critically important mental health issues and behavioral health issues are in our school system, and the struggles that are going on through COVID. But it's something that has mattered forever, quite frankly, and has been neglected, I believe, forever. And the fact that we all took a step forward in including funding for the consortium was a big deal. This actually is a very modest tweak, adjustments to the consortium. As you may recall, the Community Health Resources Commission is the staff to the consortium, and they, of course, were created in 2005 to expand access to health care services in underserved communities. They're doing a terrific job, quite frankly. They're doing a terrific job on a lot of things. We've assigned them a lot of duties lately, and they're working on the disparity, health disparity program that just went out. I think the RFPs have come back and they've made some selections. A lot of good stuff that's happening. We want to help them do their job, and that's what this bill does. Four quick things, and then I'll let the panel speak. It's to add 2 additional members to the consortium, one representing the Maryland Medicaid program and another representing CHRC, adding 2 additional PINs to CHRC to staff the consortium for a total of 4 PINs, clarifying the role of the consortium and the relationship with CHRC, and determines that the chair of the consortium will be appointed jointly by the presiding officers. That's all it does. But those things are important to making sure that this really works, because it's got to work. It's just too important. And with that, turn it over to Chairman Casemeyer.
Welcome,
you,
Mr.
Mr. Chair.
Chairman. As the lead witness, you get up to 5 minutes.
I don't think I'll take that long, but thank you.
Okay.
It's good to see you and committee
Yeah.
members. Nice to be back. As the chair indicated, CHRC has been in existence since 2005, and as he said also, we try to provide access to health care in underserved areas. And since 2005, we've supplied 648 grants, having a total value of over $100 million into all areas of the state, and it's helped over 500,000 people have been involved in those grants. We believe that this bill, as Senator Gazzone has put forth, will definitely make it easier and make it more efficient for the consortium to begin functioning this spring. Having a person on the commission who has experience in Medicaid, we think will help immensely, in the sense that they will enable us to maximize Medicaid revenue for the behavioral health services that we will provide. Also, the addition of the 2 pins would be a great help. Mark and his staff do a fabulous job, and these 2 pins will really help us out with the workload. And I think the appointment of the chair by the presiding officers is a good move in terms of being able to select the person who is probably the most competent to continue these studies. So I hope that when the consortium starts, we'll be able to make you proud that we've met the objectives of your legislation. We do a good job. Good seeing you all.
Thank you so much, Mr. Chair. Jill Bonenkamp, NCSMH. And you're going to tell us what that is.
Absolutely. Thank you, Madam Chairperson and members of the committee for having me today. I'm Jill Bonenkamp, and I'm a clinical assistant professor at the University of Maryland School of Medicine in the Division of Child and Adolescent Psychiatry, and core faculty at the National Center for School Mental Health, which is the NCSMH. Our National Center for School Mental Health has worked for over 25 years to advance school mental health research, training, policy, and practice nationwide. This includes leading the School Health Services National Quality Initiative, funded by the U.S. Department of Health and Human Services. And we are happy to be involved in this important work in Maryland and provide technical assistance in school mental health.
Thank you all for being in EHE and for your testimony. Colleagues, questions? Thank you. Senator Carosa.
Chair, and thank you for this bill. And my question was for Mr. Mark Luckner. I didn't know if he was testifying or if he's here for questions. I first want to thank the Chair Casemeyer and Mr. Mark Luckner publicly for all of the good work through the Community Health Resources Commission. You have done an outstanding job of prioritizing grants in underserved areas, and I'm hands-on with some of the awardees in my district, so I want to thank you for that. My question is, given your successful track with that program and the addition of the Maryland Consortium on Coordinating Community Support, I just want to know, and this might be more logistically, how does this all come together so we are still successful in the one, the program we've been doing with the healthcare grants in the underserved areas and the new work that and I know that staff is part of it, but you have a successful program now, so I just want to know how you think running this, how it all comes together.
Sure, thanks for your comments, Sen Carosa. It's been great to work with you when you're on appropriations, so thanks for that. So I guess I'll refer to our budget testimony, which was earlier in the Senate Budget and Taxation Committee. I sort of see our commission now, thanks to the growth based on the General Assembly's bills the last 2 years, in thirds. The first third is our statutory original mission since 2005 to expand access in underserved areas. And as Chair Casemeyer said, 648 grants serving 500,000 Marylanders. Second is the Maryland Health Equity Resource Act, or the disparities bill that the Chair Zone referred to earlier. And we just awarded 9 grants earlier this month, or 2 weeks ago, one of which is to Title Health, so you're probably aware of that. So that's the second third. And then the third third is this bill you see before you, the consortium. And so our office is going from a current staffing complement of 4 PINs, which was about right for the first third, to 3 additional PINs for that second third, or the HERC program, and now 4 additional PINs for the consortium. So the growth in responsibilities is commensurate with the growth of PINs, which is why our chair's bill adds 2 additional PINs to staff the consortium.
So now, and I understand the need for the PINs to support the additional work. I think what I was trying to better understand is, now as you've explained the three tracks that the commission is on, and I think in some cases there might be some overlap. And obviously in your position, having the overview, I just, was just really trying to see you know, again, my experience has been with, you know, on the one track and how with these other two tracks, how we just make sure we're, in addition with having staff, how that's best coordinated.
Well, I mean, I think it first starts with having an outstanding commission chair, so you have that person to your left. I mean, no, if I didn't have a good chair, it'd be a lot harder. And then the second thing I would say is you gotta have a really great group of staff. And so I'm really grateful to the Maryland Department of Health's Office of Human Resources that's helping us recruit for these key positions. And then third, you know, I'm gonna have to be really organized and compartmentalize things and just be very detail-oriented. You know, for folks that know me pretty well, I'm type A to a fault. So it's a blessing and a curse, but it's good for employment.
And Mr. Chair, maybe you have some insights. I just, I'm really impressed with the one track, and I don't know as much about the second track. And of course, now there's a third track, so you might have some insights as well.
I don't know if it's an insight. I think Mark didn't give himself enough credit. He is incredibly well organized. We talk practically every day. I would think maybe one would question whether we have the capacity to do all this with our resources. I think we are incredibly efficient. It's certainly taking on a new perspective from the commission, but considering what we've done previously, I think the legislature has made a wise choice picking our organization to head this up, and hopefully I'm confident we'll do a good job, even though it's into a specifically new area we haven't concentrated on previously.
And I appreciate that, and I would agree it is well organized. My only maybe request would be, although I know you focus on your updates with the budget and appropriations committees, if you, those of us who are also interested in being updated, because as you said, this work is really important, so thank you.
Yeah, you know, on your comment, I was just saying to my chair, this commission hasn't come before this committee a lot, so be happy to come back to you as frequently as you'd like to hear from us, and we're happy to have individual contact you, Sen Carosa, during the interim.
Look forward to it. Thank you.
Thank you, Senator Carosa. Senator Patterson.
Thank you, Madam Chair. Just, I guess, a follow-up question to my colleague from the East Shore. I think that's the right area. How much of this information out there, is it transparent? Can I go online and take a look at the various types of grants and how they, what purpose they might have been for and all that kind of stuff?
Good to see you again, Senator Patterson.
Good to see you. Thank you.
The short answer would be yes. We really believe in having an open and transparent process to make sure that folks that want to apply for a grant get as much information in advance. And we really pride ourselves in providing technical assistance to first-time applicants. And then once the grant awards are made, we put up short paragraph summaries of each award onto our website. And if there's a particular type of grant you'd like to know more about, or an area of the state, or a behavioral health grant, I'd be happy to give you as much information as you'd like.
Okay, I'd like to take that as a follow-up. Thank you.
I see no other questions, so thank you so much again, Mr. Chairman, Mr. Luckner. Yes.
Thank you.
Bonenkamp. Thank you all. That completes the hearing on Senate Bill 802. And I saw Senator Zucker walk into the room. You are, sorry? Yeah. Senator Zucker, Senate Bill 705, Education, Physical Restraint and Seclusion, Limitations, Reporting, and Training. And your lead witness, Leslie Margolis, Guy Stephen, and Rachel London, if you all want to come forward either at the table or in the first row.
Actually, is it okay if I have the superintendent? I think it's going to be the superintendent, Leslie, Guy, and then Rachel will be the, right after that, if that's okay with you, Madam Vice Chair?
I don't see the superintendent, but okay, it's your choice. Welcome back to EHE, Senator Zucker.
Well, thank you very much, Madam Vice Chair, distinguished
is.
colleagues.
Hello, Mr. Chowdhury. Welcome.
Thank you. Thank you very much, Madam Vice Chair. For the record, Senator Craig Zucker here in support of Senate Bill 705. I think many of you have heard recently, especially in Frederick County, the issue that happened when predominantly individuals with developmental disabilities were restrained and secluded. inappropriately, so much so that the Department of Justice got involved. I think many of you heard some of our colleagues address it on the Senate floor. And look, we've got just an unbelievable team of experts here that will help answer any technical questions and walk through the bill if you need. But the bottom line is, look, education has changed. The superintendent knows it better than most, and same with the advocates. Education has changed. And things that we might have done 100 years ago or 50 years ago might not make sense in this current time. And one of those things that does not make sense is secluding children in public schools. So what this bill does is it prohibits children who are predominantly disabled or from minority communities from being secluded in public schools. It also codifies regulations that we have already on the books when it comes to restraint and codifies that into law, that public schools could and still, in certain circumstances, conduct restraint. But this is all about really protecting the children and making sure that we're catching up to today's techniques, teaching techniques, the resources that we're blessed to have in the state of Maryland didn't exist 50, even 40, 30 years ago. So this legislation, I believe, is not a knock on any school or any school district, but more so it's, look, let us take a step forward and realize that this shouldn't be happening, that there's things in place that we have resources now, knowledge and training that can help address this. So this legislation helps to make sure that, again, we're prohibiting seclusion in public schools, and it also makes sure that there's certain criteria set forward when it comes to using seclusion in non-public schools. I have a great witness panel, and also I wanted to mention that Juvenile Services, I believe, had put in a letter of opposition. That was, I guess, a miscommunication, because we have an amendment that we worked on with them that is in your folder. So with that amendment, they removed their opposition. So I just want to flag that for you. But with that, if it's okay with you, Madam Vice Chair, I'll turn it over to the superintendent.
Superintendent, can I just say on behalf of our committee how much we appreciate having you leading the Maryland State Department of Education, and how much we have enjoyed the dialogue and the engagement with you through COVID.
Thank you so much. Thank you. Thank you, Vice Chair Kagan. Thank you, members of the committee. Senator Zucker knows I am excited about this bill. I think it can be better, and so I wanted to share the department's thoughts on how I think we can build off of it, but it is a step in the right direction. Again, good afternoon. I am Mohammed Chaudhry, State Superintendent of Schools. I believe in grounding these conversations in research, and research consistently shows that there is no evidence that using restraint and seclusion is effective. The department submitted written testimony with more detail, but I came here to make 3 important points. First, there's no place in Maryland public schools for the use of seclusion, whether those are public or non-public schools. Locking a student in a room by himself and preventing him from leaving is simply unacceptable. Regardless of whether that room is in a public or non-public school, the bill should ban seclusion entirely. Second, all but most limited forms of restraint in the most extreme and rare situations should also be banned. The bill should also include types of restraint that cannot be used. Third, schools restraining or secluding students unlawfully or frequently must be held accountable. In these cases, the bill should require a systemic, evidence-based, and time-bound corrective action plan. For such matters, simply doing more professional development is not the answer, and I say this as an educator. I do want to thank the sponsors of this bill for their dedication and work. I know we are working towards similar goals, and the bill does take an important initial step forward. As you continue to debate and refine, I suggest you refer to the Keeping All Students Safe Act, a federal proposal that includes strong definitions of relevant terms and protections for students, including by banning seclusion. Indeed, if we can strengthen and pass the bill, Maryland has an opportunity to be a true national international leader. I want to read from you just a short passage. ProPublica did an investigation into Illinois, who had restrictions in place on seclusion, and found appalling misuse of seclusion. And so I'm going to read a short snippet for you. The spaces have gentle names: the reflection room, the cool down room, the calming room, the quiet room. But shut inside them, in public schools and private schools across the state, children as young as 5 wait for their parents, scream in anger, beg to be let out. The students, most of them with disabilities, scratch the windows or tear at the padded walls. They throw their bodies against the locked doors. They wet their pants. Some children spend hours inside these rooms, missing class time. Through it all, adults stay outside the door, writing down what happens. It led to an emergency ban on seclusion, and then just this year, the state passed a complete ban on it within a 3-year window. I thank you guys for giving me the time to come today, and of course, please reach out to MSD if we can be of help anytime. Thank you. Thank you, Senators.
Let's see, Leslie Margolis, Disability Rights Maryland. Welcome back to EHE.
Thank you. Good afternoon, Madam Vice Chair and members of the committee. My name is Leslie Margolis, and I'm a managing attorney at Disability Rights Maryland, the organization mandated to protect and advocate for the legal rights of people with disabilities throughout the state. Our written testimony and the written testimony of the Education Advocacy Coalition explain in more detail why we support this legislation. Let me first say I am so excited that Superintendent Chaudhary is here today. I have sat before you on and off since 2002 advocating for restrictions on the use of restraint and seclusion in our schools. I understand that this work is incremental. Never has a superintendent of the Maryland State Department of Education shared a panel with us. Thank you so much, Superintendent. In 2017, Senate Bill 786 required data collection for the first time. And what we've learned from the data every year is that further legislation is needed because restraint and seclusion continue to be used at high rates throughout many jurisdictions. And they are used disproportionately with children with disabilities, with children of color, and with very young children, sometimes as young as 5 or 6 years old. In 2017, you watched the video of my young client being dragged down his school hallway on his knees and pushed into a seclusion room, and you saw him curled up in a puddle of blood when the door was opened a few minutes later. Unfortunately, students continue to be injured and traumatized while being restrained and secluded in our Maryland schools. This legislation would help address that situation. Among the provisions, as you've heard, are a ban on seclusion in public schools and restrictions on seclusion in non-public schools. We would love to see seclusion banned through all schools. There are also accountability provisions for all schools and for the State Department of Education to reduce the use of these aversive interventions. The Department of Justice should not have to set up shop in Maryland, jurisdiction by jurisdiction, to address this issue.
Thank you, Ms.
Thank you.
Margolis. Appreciate your testimony and your leadership for a lot of years. Mr. Stephan or Stephen?
Thank you. And I first have to say, wow, and I appreciate you being here and providing your testimony. I couldn't agree with you more, and I appreciate the honesty. So this might get me off track, but I want to tell you, first of all, I'm here as a father, and that's what's gotten me involved in this. And for over 3.5 years, I've not only been advocating for my son, but the many children around the state of Maryland and across the country.
Could you please start by saying your name?
I'm
and
sorry.
Your affiliation?
I got so excited. My name
Yeah.
is Guy Stevens.
Thank you.
So about 3 years ago, my neurodivergent son Cooper was illegally restrained and secluded for the last time. The experience left him traumatized and afraid to return to school. As a result, he finished the remainder of the school year in a home and hospital program. Before our family's experience, I would never have imagined that children are routinely restrained and secluded in schools across the state. I talked to my son about what had happened to him, and I made a promise I would do anything within my power to make sure it didn't happen to him again. I immersed myself in research. I wanted to understand why this was occurring and its impact on teachers, students, and staff. I know that we can reduce these practices, and I've done a lot of research in that direction. I examined data. I found out from the 2017 legislation that my school system, Calvert County Public Schools, had the highest rate of seclusion and the second highest rate of restraint when you looked at it against enrollment. You know who was number 2? Frederick County was #1 in restraint, #2 in seclusion. I've been talking about that for about 3 years now. We can do better. In Calvert County, we formed a committee. We began to look at what we could do to reduce and eliminate these practices. We brought in additional training, but the biggest thing we had to do was change the culture. It's about changing culture, not just changing training. We brought in practices like UCARO, a trauma-informed alternative to restraint and seclusion. We brought in something called collaborative proactive solutions. Back in 2017, 2018, we reported 576 instances of restraint, 701 seclusions. In the current school year, we've reduced that down to about 10 restraints and only 1 instance of seclusion. It absolutely can be done in public, in non-public schools. There are many ways to do it. Please, I'm doing this for my son and the many other kids that are out here. Please, please, please do all you can to protect these children.
Mr. Stevens, I feel like we've seen pictures of your son in past years. Am I making that up?
No, you're not. I actually,
Okay.
about 2 years ago, provided testimony, and our organization has grown to about 18,000. And I was in Congress 2
Yeah.
weeks ago talking about the Keeping All Students Safe
Well,
Act.
Thank you for your leadership, and your son is growing up. He's a cutie.
Yeah,
That's
yeah.
great.
He's actually 16 now and loves being along the bay and the river,
That's
and he's
great.
talking about college. So
That's fantastic. All right, thank you all for your testimony. We're going to take the rest of the proponents, and then we'll take questions at the end. So next up, Andy Culp from the ARC, Marjorie Clark from the Ivy Mound School, Aaron Parsons from Kennedy Krieger. We'll do them in threes.
I think, Madam Vice Chair, we should have Rachel London on there.
Okay, and Rachel London. Sorry, we have a lot of, okay.
And Andy Culp.
Hello, Rachel London. It's nice to see you.
Nice to see you.
If we can just have 3 at the table. Oh, yeah. Okay. We have different codes and different systems, I think, on this bill. Okay. So, Rachel London, you may begin your testimony. Welcome back.
Thank you, Madam Vice Chair, members of the committee. I'm Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. We are a statewide public policy organization that creates change to make it possible for people with developmental disabilities to live the lives they want with the support they need. You've heard a lot about why this is necessary, how it's possible, and what needs to be done. So I just want to reiterate a few things. The first is there are actually 6 local school systems that already ban the use of seclusion in Maryland: Anne Arundel County, Baltimore City, Caroline, Prince George's, Somerset, and Wacomico. Howard County's board voted just in the end of last year to ban seclusion for the next school year. And like you've heard, it shouldn't have to be a school system by school system approach. So we are equally excited to be here with the superintendent. Second, I also just want to reiterate a little data. In the 2019-2020 school year, when schools closed halfway through the year, the use of restraint increased in 4 local school systems, even though kids were only there 6 months out of the year. And seclusion incidents increased in 6 jurisdictions. So not only is that data collection important, the increased data collection and accountability, like you heard from the superintendent, is equally important. MSD collects this data, but really does no analysis, right? Right now, we don't get trends or target districts with high numbers. So while data needs to continue to be collected, this bill really does require more and more reporting so that we're holding our local school systems and our State Department of Education accountable to reduce and eliminate the use of these harmful practices. Thank you.
Dan, appreciate it. Good to see you. And next, other witnesses, Andy Culp, Marjorie Clark.
Yes.
And then they'll be followed by Aaron Parsons, Christina Cardo, Kathy Flannery. But let's see. Andy Culp, welcome.
Yes. Hi, good afternoon, Madam Vice Chair, members of the committee. My name is Andy Culp, and I'm with the ARC Maryland. And the ARC is the largest statewide advocacy organization dedicated to the rights and quality of life of people with intellectual and developmental disabilities, and we're here in support of Senate Bill 705. So I don't duplicate the testimony that was said before me. I'll just hit on a couple points. Another data point from the 2019-2020 school year, which was interrupted by a few months by the pandemic, showed that restraint was used over 12,000 times statewide, and close to 60% of all students involved were students with disabilities. Seclusion was used over 6,000 times, and 57% of those incidents included children with disabilities. So despite regulation policy and known national best practices, many Maryland school systems and many of its nonprofit schools use restraint and seclusion regularly as a behavioral management technique and tool, but it's not, as you've heard. With the removal of seclusion and the curtailing of restraint in this bill, the bill requires support for teachers, so they have new tools and techniques to use to support children, and that's critically important that they use these tools in trauma-informed care, because what we don't want is students who have behavioral needs, in school, to be pushed out of their neighborhood schools and put into separate schools because teachers don't feel equipped to be able to manage their care, their behavioral support needs. So that part of the bill is really important to us, along with the data collection and accountability provisions. So in closing, just thank you for your time, and I urge your favorable report on Senate Bill 705. Thanks.
Thank you for all that the ARC does.
Thank you.
All right. Marjorie Clark?
Hi, yep, it's me. They call me Kimmy, so
Kimmy.
call me Kimmy Clark or Marjorie Clark. My name is Kimmy Clark. I'm the autism director at the Ivy Mount School, which is in Rockville, Maryland. We're non-public in Montgomery County. And I want to start by sharing my strong support for Senate Bill 705. I'm extremely supportive of a bill that seeks to improve training, monitoring, and oversight of the use of these really restrictive practices, and that should be emergency use only. I'm here, however, to request an amendment to include licensed behavior analysts, I'll say LBA, as a qualifying healthcare practitioner as defined in this bill. Behavior analysts practicing in Maryland must be licensed by the Maryland State Board of Professional Counselors and Therapists. Ivy Mount currently has 38 LBAs on site for about 200 students. Our LBAs are responsible for conducting functional behavior assessment for the development of individualized behavior plans. Simply put, they spend substantial time reviewing historical records and data, interviewing students, teachers, caregivers, observing the student, and building trust and supportive relationships with each student that they support. The extensive assessment process is included in the coursework and the fieldwork experiences that are required to become an LBA in the first place. So therefore, they're completed with competence, even by the most newly licensed behavior analysts. I believe this practice is in line with the activities that one would expect a healthcare practitioner to complete to determine whether seclusion is contraindicated as specified in the bill. Additionally, it's the basic expectation of licensed behavior analysts, in all settings, not just Ivy Mount, to observe and interact with their students they serve regularly in multiple contexts. And this well-rounded knowledge of the student places them in the best possible position to monitor student safety and overall well-being while in seclusion. The inclusion of LBAs as healthcare practitioner is in line with the spirit of this bill, which I believe is to improve the health and safety of our most vulnerable population of students. So I appreciate your consideration of the amendment.
Ms. Clark, and before we go to the next panel, I just have to say that Ivy Mount is located at my elementary school.
Oh, really?
In that building. That was 352 years ago. So.
Oh, amazing.
All right. The next panel, Erin Parsons from Kennedy Krieger, Christina Cardo with the Schaefer Center, and Kathy Flannery with Shepherd Pratt. You all can come up and start your testimony in any order. Welcome to EHE.
Any order?
Any order, go for it.
Good afternoon. Good afternoon, Senators. I'm Dr. Erin Parsons, Vice President for School Programs at Kennedy Krieger Institute. On behalf of Kennedy Krieger School Programs and MANSEF, our State Association of Non-Public Schools Serving Students with Disabilities, we are here to support Senate Bill 705 with a request for an amendment. Kennedy Krieger works in partnership with our local school systems to place students with complex needs in our highly specialized school settings. We serve approximately 500 students in our 4 schools. We strongly support the goals of Senate Bill 705. Physical restraint and seclusion are serious, last resort techniques for ensuring safety in a crisis. The use of these interventions must be immediately balanced against the risk of failing to intervene in the presence of imminent danger to a person. Efforts to improve safety for students when the risk requires the use of either restraint or seclusion must be supported. Bill Senate 05 provides additional safeguards for Maryland students. Rigorous clinical involvement regarding the use of seclusion in a school can prevent its misuse and abusive practices. For both restraint and seclusion, the data reporting, mandatory review, and data-driven action required will ensure that Maryland schools engage in policy review or revision to create better outcomes for programs and students. The need for robust clinical involvement, including observation, assessment, and meaningful data review, are at the center of our request for an amendment. This is to include licensed behavior analysts to the list of healthcare professionals authorized to provide oversight of the use of seclusion in non-public schools. These clinicians are highly skilled in behavioral observation, assessment, and data analysis. The importance of behavior analysts was central in the recent agreement between the United States Department of Justice and the Frederick County Public Schools.
Dr. Parsons,
Thank you for considering our thoughts on this bill.
we appreciate them. Thank you. Christina Cardo?
Good afternoon, Senators. I'm Dr. Christina Cardo, Director of Clinical Programs at the Schaefer Center. I'm a licensed psychologist, a BCBA-D, and an LBA. The Schaefer Center is a school that welcomes students with the most intense problems behaviors to our program, and we are really proud to work with these students and these families. I'm here to express support for Senate Bill 705 with an amendment. I support the members addressing this critical issue. I agree the use of restraint and seclusion must be carefully monitored and done only when needed for the safety of the student and others around them. However, the proposed language puts the safety of students at risk by excluding healthcare professionals, which the most significant experience, oversight, and analytic skills to seclusion by omitting licensed behavior analysts. LBAs are required to hold a BCBA credential, which require being trained to work with those students who are engaged in dangerous behaviors. We focus on determining the function of the behaviors or the why the students engage in those dangerous behaviors. We're required to do analysis, teach functional alternatives, and take specific data on interventions put in place. In addition, we are required to have strict adherence to our ethics code designed for working with students who would need interventions such as seclusion. At the Schaefer Center, the safety of our students is the #1 priority, and it's because of this mission we currently have 8 BCBAs for 32 students. These are the best professionals to assist in making safe and meaningful progress for our students, whom other schools often reject or cannot manage. As a psychologist and a BCBA, all of my knowledge and expertise in this area was gained through my BCBA training and continuing education requirements. Very few psychologists have this expertise or training, and those of us who do are part of the behavior analytic community. Please amend this bill to include LBAs as one of the healthcare professionals authorized to provide oversight to the use of seclusion in the non-public schools. Thank you so much for your consideration in this bill.
Thank you, Dr. Cardo. Before we go on to the next witness, I just want to say, because I'm not sure that Chair Pinsky said this earlier, the fact that some of the senators are absent is not at all reflective of any lack of interest in this bill or the prior ones or the upcoming ones. We do have bill hearings in other committees, and so we're popping up and down and all that. So we are glad you're here, and our excellent counsel helps guide us and is taking copious notes and stuff as well. So I just want to reassure you of that. The empty seats are not for lack of interest. Kathy Flannery, Shepherd Pratt.
Yes. Good afternoon, Madam Vice Chair and the committee. My name is Kathy Flannery, Regional Director for Shepherd Pratt Schools. I have been with Shepherd Pratt for 21 years. We provide non-public special education services in 12 schools in 6 counties across Maryland. We serve 600 to 700 students annually. Today, I am here on behalf of Shepherd Pratt that we support Senate Bill 705 with an amendment. Like my non-public counterparts, Shepherd Pratt Schools request that licensed behavior analysts are added as healthcare practitioners who qualify as professionals that can observe seclusion and/or determine if the use of seclusion is contraindicated for a student. The mission of the LBA Certification Board encompasses the values of protecting consumers and disseminating professional standards of practice. LBAs are experts in the field of applied behavior analysis and uniquely qualified to directly observe, assess, and determine effective individualized interventions for students. Their reliance on using systematic approaches and making data-driven decisions leads to socially significant improvement in behavior. Our LBAs at Shepherd Pratt allow us to serve students with significant behavioral challenges, such as self-injurious behavior or aggression. As members of a student's IEP team, LBAs spend the most time in the classroom observing students when they are engaging in maladaptive behaviors. Our students can engage in behaviors at frequencies that exceed 100 incidents per day. Currently, when more intrusive interventions are necessary to keep the student and the classroom environment safe, our LBAs and other professionals are present to observe and monitor the student. You've already heard Senator Zucker mention the investigation with Frederick County Public Schools. In December of 2021, the U.S. Department of Justice and Frederick County Public Schools reached a settlement agreement that provides further evidence regarding the critical role of a licensed behavior analyst. The agreement requires that individuals working with students in self-contained classrooms be certified behavior analysts at a minimum ratio of 1 assistant behavior analyst to every 20 students. This furthers our stance that licensed behavior analysts be included as an amendment in Senate Bill 705. Thank you for your time and consideration.
Perfect.
Timing here. All right. Thank you, Ms. Flannery. The last two, and again, we're going to hold questions if there are some for all of the proponents. Rachel Mayer from Linwood and John Woolhams from MABE, the Maryland Association of Boards of Education. I don't know if I see Mr. Woolhams. There he is. Okay. Welcome. You all will wrap up the proponents. You may begin.
Hi, good afternoon, esteemed committee. My name is Rachel Marr, and I'm a licensed behavior analyst working with the Linwood School, another non-public school located in Howard County. I come today to you as a board-certified behavior analyst for the last 12 years. As a field, one application of ABA, Applied Behavior Analysis, looks to improve the lives of individuals who at times may engage in behaviors that have the potential to cause serious injury to themselves or others. Not only do these behaviors preclude the individual from accessing the learning environment and engagement in pro-social behaviors, but most importantly, stand the risk of doing irreparable harm to that individual. As an LBA, our ethical code requires a least restrictive approach and intervention first and foremost. However, due to learning history and the severity of the presenting behaviors, at times seclusion and/or restraint may be needed to result in immediate protection of the individual and those working with them. LBAs are charged as authors of comprehensive behavior intervention plans, which should accompany any considered use of seclusion and/or restraint, and as such should have a hand in the oversight of any approved use of these practices moving forward. Additionally, as a highly data-driven field, the licensed behavior analyst is the appropriate clinician to help assess the efficacy and continued need of such interventions. I support the adoption of this bill, but only with amendment to include the oversight from the licensed behavior analyst. I thank the committee in advance for their time and consideration.
Thank you. Mr. Willems.
Madam Vice Chair, members of the committee, John Woolhams, representing the Maryland Association of Boards of Education. Pleased to be here today to testify in support of Senate Bill 705 to eliminate the practice of seclusion and govern more strictly the practice of restraint in public schools and non-public schools in the state. I also date back to 2002, and one of my first collaborative stakeholder processes was with Ms. Margolis on reviewing the state's approach to restraint and seclusion, and this legislation has been a long and probably too long time coming. I do want to recognize Senator Zucker's leadership on this issue over years, and we have done everything possible, I think, to be as collaborative as possible in moving this issue forward. And so the MABE amendments to this bill are really described as addressing issues of timing and scope. If we are going to basically make illegal a practice that is ensconced in state law and regulation, represented by facilities, use of facilities, training of staff, there needs to be some plan to make that transition. And so there's always the concern that on July 1, the effective date of this bill, the perception and reality match up, that these practices are in fact no longer being utilized, staff have been retrained, and then there's the non-public placement issue. The bill is drafted, as was emphatically and passionately addressed by Superintendent Chaudhary, would make a practice illegal in public schools and not illegal in non-public special education schools, which raises the concern about a gateway to non-public placements of students from public schools to those other schools. So that's a concern that we want to highlight. But again, we are supportive of the legislation, supportive of the transitions represented, and under MSDE's leadership and Superintendent Chaudhary's leadership, we're confident that we'll make incredible progress over just the next few months on this issue. Thank you.
Mr. Willems and colleagues, you know how I said that Mr. Willems was going to be last? I overlooked Jeannie Marie Lutsakos. Is she still here? I'm so sorry. Please come forward. We'd love to hear from you. And Ms. Lutsakos will be our final. Mr. Willems, why don't you, okay, if one of you want to, Ms. Marr? Okay. Thank you so much. You have up to 2 minutes.
Thank you. I'm Dr. Jeannie Marie Leotsakos, and I'm here in strong support of SB 705. I'm here as a parent. Like many autistic kids, my son was a runner. He never tried to leave the building and wasn't in any actual danger, but school staff would chase him, corner him, and restrain him. He ran more and started fighting when cornered. This happened up to 4 times a day. The school would call me, and when I got there, sometimes they'd be chasing him down the hallways. Sometimes I would find him being pinned to a chair by multiple staff members. Or on one occasion, he had been confined to a small blue room, was shirtless, drenched in sweat, crying and begging for water. At home, he was having nightmares about monsters chasing him and would say things like, "My entire life is going to be a struggle, and I want to die." To ensure his safety, we now homeschool. Things are better, but he's not the same kid as he was before. This is what repeated use of restraint does to kids, and his story is far from unique. Among other things, this bill requires case review for children who are restrained repeatedly and promotes the use of better, safer alternatives, and they already exist. Had this law been in effect earlier, things might not have gotten so bad for my son and other kids like him. This bill also requires that collected data are actually analyzed. You'll see in my written testimony, I'm a statistician, that restraint and seclusion disproportionately affect Maryland's most vulnerable children, children under the age of 10, children with disabilities, and African American children. There's also considerable variability among counties, which is unlikely to be completely explained by enrollment, caseload, or placement practices. As we saw when Calvert County switched to UKIRO in 2019, training and mindset have an enormous impact. This bill takes an important step toward ensuring the safety and civil rights of Maryland's most vulnerable children, and I urge you to report favorably. Thank you.
Thank you so much for your testimony, and I'm sorry about your son, Ms. Leotsakos. Thank you for being with us. Senator Washington, why don't you start with the questions?
Bill sponsor be up as well. And again, I wanted to say to the parent as well that I'm sympathetic and support you 100%. Thank you. Thank you, Senator Zucker, for bringing this, and thank you everyone who's speaking in support of it. And I am going to ask a question. So, but just the similarities, of course, with a bill that that has come through this committee around disruption and suspensions and all that. And so one of the questions I wondered is the definition of what a seclusion is. I'm assuming there's variability among the different schools, and like how are you defining it? And more importantly, I guess, the criteria for excluding. Do you find that there's consistent? Yeah, go ahead. Yeah.
I can answer that?
Yes, you can,
No,
please.
okay. Hi, Maryland COMAR has a definition for seclusion, which is the removal of a student to a confined location from which they're, the learning environment, from which they're prevented from leaving.
But
The
then-
criteria is clear and imminent risk
Yeah.
to that individual.
Right. Do you find that there's universal application of what risk is and who's at risk and who's causing a risk and who isn't?
I think that's probably at the crux of where misuses have happened in the past. Sorry, I don't know if I'm the one.
Yeah.
It probably is a definition. At our school, we definitely strive for it to be a risk that if we are not the intervening provider, unfortunately, something like a medical professional will need to be called.
So is that?
If I may, so the standard that's, the Maryland State Department of Education has made clear in policy, and that's in the law, is imminent serious physical harm to self or others. That's what's in COMAR. And then the State Department of Education in its policy has made clear that that is risk of death, of serious bodily harm, of, I'm looking for the list, it's for very, very high standards. So it's risk of death, it's risk of loss of bodily function, extreme pain. It's a very high standard to meet.
But in your assessment, Howard, is this the standard that's applied in every situation?
No, and I think that's the issue, that what we find, certainly in our experience, looking at cases that come into our office and looking at the data, or that restraint and seclusion are applied in many, many situations that don't rise to that level. And in our office, what we've often done is filed complaints on behalf of our clients with the State Department of Education, which has often found violations of the regulations.
Did you want?
I mean, I was just going to say that, the fact is that, even though something is in coma, or obviously based on what you saw in Frederick, different school systems have a different interpretation. So the standard should be that there is no such thing as seclusion anymore in public schools.
Yeah, and you're calling for a full-on ban, and so I think that I was interested in that. But I think you also said that there were school systems, or that there's rules about not doing it, and you still think it's being done. Is that something that we're finding? I'm just curious. Are there school systems, and you don't have to name them, but are there school systems or situations where it's still occurring even though on the books it's not supposed to?
Well, I think one is, it looks like based on the fact that it's been used inappropriately in the past, now you have individual local boards of education or local school districts going ahead and banning it unilaterally. So I think, ultimately it's, just, our focus is on, just making that there's uniformity across the board, making sure that if no one's doing it, then there's not going to be any question of how people are proceeding with seclusion. I mean, if fact is like if someone's locked in a room, is it someone having their eyes on them? I mean, that's going to now be off the table. Now they shouldn't be secluded in a room.
And then just one more, Madam Chair. So this similar, again, I've been looking at suspensions and this as well. I'm assuming some of your suspensions. And clearly you talked about the disproportionate number being disabled, but also, of color, African American, way beyond their numbers. And that doesn't explain, and like certain districts seem to have more than others. And they're not all, so is that the case also with the use of this practice?
Yeah, it's really significantly disproportionately used with children of color in a number of jurisdictions.
So they're doing the same thing?
Just,
doing the
it's
exact
similar
same
to
thing,
the
but
suspension.
A black child is
Yes.
secluded,
Yes.
and something else is happening with the white child.
Yeah.
Okay, thank you. Okay, thank you. Thank you, Madam Chair.
Response?
Sir, certainly.
I just wanted to share that in my research, which has been extensive, the majority of seclusions that happen across the state.
Mr. Stevens, two things. First off, generally, we only have one witness speak
Okay.
to a bill, but to one question, but we're happy to allow it in this circumstances, but I am going to ask you to speak into a microphone so it can be heard at home. Thank you, Mr. Willems, appreciate it. Ms. Margolis, yes. Good.
Thank you.
Okay, briefly.
And I apologize, but I'm very passionate about this
you are.
because of
Go
what
ahead.
happened to my son. What we find is, though we have this high standard that says imminent serious physical harm, a life or death situations, kids are routinely restrained and secluded for noncompliance, for disrespect, for minor behaviors, for refusing to clean up their area. My son once was restrained and secluded for splashing water, certainly not a life or death situation. Kids for flipping light switches on and off, or refusing to clean up their desk. It's an intervention that's more commonly used for the non-life-threatening situations. In fact, if you're having hundreds of life-threatening situations in your school over the course of the year, you're doing something wrong. So absolutely, when you look at what the law says today and what's been happening, the two don't mesh together. That's why what happened in my county happened. That's what happened in Frederick County happened.
And that's why the thank you, Senator, for putting the reporting requirement, and actually I'm going to think about that, because knowing exactly when it happens and also doing something about it and noting that, okay, if it's above a certain percent, then there needs to be a specific kind of intervention. So I think it's good to have that as well.
What we found is, the reporting requirements came into place in 2017, and every year since then, there's been a report from the State Department of Education to the General Assembly but there's been no analysis of that data, and it's not triggered any kind of accountability. And so we've come back in 2020 and 2021 and tried to get that accountability piece built in. So this, I think, is the strongest iteration of that.
Absolutely.
And, really exciting that NSDE is on board, because it's so essential.
Yeah, thank you.
Thank
Thank
you.
you, Madam Chair, for flexibility.
Senator Washington, other colleagues with questions? I think I'd like to just ask the wonderful Senate sponsor, if you can just make sure, we heard a lot of different ideas about amendments, and I suspect that it's going to be hard for us to navigate who wanted which one and where the overlap was. So first off, any of the advocates, now that you've heard about other people's suggestions on amendments, and I don't know that we want 400 more emails or something, but if there's some ability to collaborate, distill the information, and report back to us, that will help guide our debate and our conversations. And we may not view every amendment favorably, but we will definitely want to have access to the information. So,
Madam Vice Chair, I've already been in touch with your counsel on that.
why am I not surprised?
Because she's that good.
She is that good, and so are you. So thank you. With that, truly, this committee and the state of Maryland is grateful to all of you for your advocacy and for your presence today. So thank you, Senator Zucker. Thank you, Superintendent Chaudhary. We're grateful to all of you for being here. That completes the hearing on Senate Bill 705, and I don't have to go to the gym tonight because I can just list this folder a few times as my weightlifting exercise. Next up is my friend and seatmate, Senator Feldman. And if I can ask you to leave quietly. Oh, you're already doing that. Of course you are.
Madam Chair, I think I saw my panelists out
Yep,
in the
I'm going to call
hallway,
them.
so we
I am
maybe
going
they
to
can
call
join
them
us.
up.
Yeah.
Senate Bill 832, Senator Feldman, Public Institutions of Higher Education, Students with Chronic Health Conditions, Case Manager. And Santi Bhagat, Natasha Bhagat, and Katie Celentano. You all can come up and join Senator Feldman at the table. And let's see, Andy Culp is going to be back. Ms. Culp can sit in the front row, and Joanne Bauman, I saw, there she is. Okay, so she's already here. Okay.
Okay.
Senator Feldman,
You ready?
let's give a moment just so it's quiet in here, and we can pay attention to you. Are we all settled in? If we can close the door in the back. Okay. Senator Feldman,
Yes,
welcome
thank
to EHE.
It's great to be here, Madam Vice Chair. So let me start by saying, according to the CDC, the definition of chronic diseases are, quote, conditions that last 1 year or more and require ongoing medical attention or limited activities of daily living or both. So there is a statutory definition within the CDC. And there are millions, and I want to repeat, millions of individuals who live with chronic health conditions, including an estimated 20 million young adults aged 18 to 34 years old. So last year, I did bring a bill to the committee that would have created a task force to study existing data on undergraduate and graduate students who live with chronic health conditions with an eye towards making sure these students have equitable access to higher ed. Right now, there are no policies in place regarding accommodations for students with chronic health conditions. There isn't even data compiled on how many students there are with these conditions. So my cross-file last year, Delegate Pena-Melnick and I decided, for a variety of reasons, not to move forward with that task force bill, but instead we asked that language be put into the Joint Chairman's report from the Budget Committees requesting that MHEC, our Maryland Higher Education Commission, and our Maryland Department of Health establish a work group to do exactly what the task force bill last year envisioned, and that's actually what happened. So there was a work group convened, consisted of 14 members, including representatives from the University System of Maryland, College Park, Maryland Department of Health, MHEC, et cetera. They met 4 times between July and August of 2021, and then they subsequently produced a detailed 21-page report in November of 2021, which should be in the possession of the committee. And the report describes the work, the title of the report is Report on Students with Chronic Health Conditions, again, from November 2021. The report describes the work that was undertaken last summer and ends up with 16 very specific recommendations that would help to eliminate the challenges faced by the students with the chronic health conditions. Those recommendations are outlined right on page 17 of the 21-page report. So if you have the report, you can go to page 17. Delegate Peña-Melnick and I met in January with MHEC and MDH to discuss the report and the 16 recommendations. And, you know, frankly, there wasn't a great deal of eagerness to step up and implement all those recommendations. But what we did do, we said at that meeting, of all the 16 recommendations, is there one, at least one, that you could identify that would be doable this year to get going? And again, there wasn't a lot of eagerness to go beyond maybe creating yet another work group. So on that one recommendation, we decided, Delegate Peña-Melnick and I, to take some concrete action with a very specific, attainable recommendation. That very 15th recommendation, again, recommendation number 15 on that list of 16. And that recommendation states, support campuses to employ centralized case managers for students to coordinate services among different departments, for example, faculty, health centers, medical professionals, et cetera, a case manager. Larger campuses may need more than one case manager. Some perhaps, I'm not sure about the number. Currently, many of the campuses have nothing like that at all. So all Senate Bill 832 does is it requires higher education institutions in the state of Maryland to designate a case manager for students with chronic health conditions, describe what the case manager will do, and then finally, very importantly, collect data that doesn't currently exist, collect data and information on the number of students who access the services and the effectiveness of those the services provided. So currently, this issue, there are very few models to draw from around the country, but luckily one of our national experts right here in Maryland at the University of Baltimore, one of the panelists, my lead panelist, Dr. Santi Baguette, will expand on why establishing a case manager will improve the experiences of undergraduate and graduate Maryland students with chronic health conditions. There's support you'll see in your packet from ARC, Maryland, physician parent caregivers, Madam Chair, Vassar College's Department of Health Services, which I know should carry great weight with you. And so with that, that's all the bill does, and I'd ask for favorable on Senate Bill 832, but I'd very much encourage you to listen to the witnesses. But obviously, I would take questions, but their stories, I think, are maybe compelling. But
Vice Chair Feldman, thank you for this bill. Before I hand it back to the chair and we welcome our witnesses, I just want to flag colleagues in our online folder the report that Senator Feldman mentioned. It is a report on students with chronic health conditions dated November 2021 with the headline from the Maryland Department of Health and MHEC, the Maryland Higher Education Commission.
yes,
So
and
you
if I
can
could
find that.
repeat that the one recommendation of the 16 is on page 17 of that report. We're only picking out one that seems very doable.
Perfect. All right. And with that, your lead witness is Sarit Bhagat, and you have up to 5 minutes, and the following witnesses will go from there, and sending it back to the chair.
Chairman Pinsky and Vice Chair Kagan and committee, thank you for this opportunity to testify on behalf of young adults with chronic conditions. This group calls themselves Young Invisibles, or YI. I'm a mother of a young adult who developed epilepsy at age 8, and I'm a physician in health policy. I founded a voluntary nonprofit called Physician Parent Caregivers to advance social justice for young people with chronic conditions. You may be wondering why we are asking for attention to this population and why now. This population has emerged almost unnoticed. 4 decades ago, children with chronic conditions were unlikely to survive, like those with congenital heart disease and cystic fibrosis. But advances in science and technology have enabled over 90% to enter adulthood today. The other thing we are seeing are conditions surfacing in young adulthood, like Crohn's and autoimmune conditions. Young invisibles are the new 21st century priority population. In college, if these students are served, it's primarily through disability support services. They get accommodations, but those accommodations do not address their chronic condition needs. Young invisibles' first need is to optimize their health. and that is incredibly hard given the way their brain, mind, and body function at that age. They need ongoing health care and guidance to self-manage their health. College health centers would be the ideal place to do that, but few college health centers support students with chronic conditions. But college is not just about academics, it's about growth and development. Young Invisibles may need support to live in the dorms, to have the appropriate food options, career counseling, internships, and to participate in campus life. This bill's recommendation for a case manager would make a huge difference to help Young Invisibles navigate college. We know that completing college increases economic mobility. Young Invisibles have and will always have exorbitant health costs. Many Young Invisibles have normal cognitive ability and are able to complete college. Their problem is their health, and they're being penalized for this. Too many students today are telling us that they have to take incompletes, medical withdrawals, and that they're being flunked, kicked out, and are dropping out. We need to know what's happening to this population and provide supports to help them graduate. If society continues to ignore Young Invisibles and their needs for support in college and work, they will end up on state welfare. This is a huge cost that our nation cannot afford. A recent Blue Cross report on millennials calls for urgent action. Millennial health is at stake. They are the largest population and will comprise 75% of the workforce by 2025. Ignoring them will have societal and economic ramifications. And today, we are in the age of inclusion. Colleges support vulnerable groups, including those who struggle with substance abuse, alcohol, marijuana, opioid, mental health, and disabilities. Why then do they continue to exclude students with chronic conditions? From our national policy work, we believe Maryland is the first state legislature to focus on Young Invisibles. The American College Health Association congratulated us on the introduction of this bill, and the Millennial Action Project in Congress was excited to hear about it. Maryland parents want to see our progressive state champion change for Young Invisibles. Maryland could be a role model for other states and Congress. We work closely with Senator Van Hollen's office, and they're interested in what happens in the hearing with this bill. Maryland is well positioned to take the lead on this. Our state has the first center on young adult health and development at the University of Maryland in College Park. They have the largest NIH-funded longitudinal study and could do a deep dive on Young Invisibles. Hopkins faculty has introduced the fields of transition to adulthood and adverse childhood experiences. I respectfully urge the committee to support the bill. It is a critical first step that could open the door to change the fate for Young Invisibles to succeed. Thank you. Now, I'd like to introduce you to my daughter, Natasha.
Okay, Ms. Baggett, please.
Here you go.
You'll need one of the mics and lean into it, please.
Thank you for this opportunity. My name is Natasha Bagat from the Invisible Wave movement, and I testified for SB 147 last year to study students with chronic conditions. I have epilepsy, which means I have seizures that are unpredictable and dangerous. At both Montgomery College and American University, I was sent to disability support services. They were supposed to help me with accommodations for classes, but these accommodations did not support chronic health illnesses. So they told me to ask each professor if they would accommodate me. While some professors were understanding, others refused to work with me. And that created anxiety that caused even more seizures. I also went to the campus health centers, hoping they would help me manage my condition. Instead, they sent me to security so they would have my information in case I had a seizure. Instead of supporting me as a student with a chronic condition, I was treated as a security risk. Meanwhile, I couldn't live in the dorms like an ordinary student because there was no one on campus who could help me figure this out. This was difficult for me because I am not a quitter. I am a second-degree black belt in Taekwondo, and I have learned to persevere. I spent a decade taking classes part-time, and I had a GPA of 3.5. but over time, my negative experiences overwhelmed me. Finally, I had to make the decision to drop out to protect my health. Now I am at a loss as to what to do with my life. My entire experience could have been different if there was a case manager to help me become a part of case life.
Thank you, Ms. Bagat. Thank you for your testimony. Ms. Salentino.
Hi, good afternoon. Thank you, Mr. Chair and members of the committee. I'm really happy to be here today to share with you. My name is Katie Celentano, and 3 years ago, my daughter Annie was 5 years old when she was diagnosed with a severe autoimmune brain disease. The chemotherapy that was ultimately used to treat her condition caused a secondary immune condition that will likely be lifelong. Her autoimmune disease flares and subsides, so it comes and goes, and it causes neuropsychiatric and physical symptoms. Her immune condition is constant, and it requires monthly monitoring and monthly infusions. Any infection, even a common cold, can cause a flare of her autoimmune symptoms and can make her sick enough to cause hospitalization. This means that my little girl, who's just 8 years old, has endured hospitals, doctors, tests, needles, and endless hours of infusions for more than a third of her life. Imagine being asked by your child when you can stop all of these things, and knowing that the answer is probably never, or at best, I don't really know. As a parent in this position, you advocate like hell for your child. You move mountains to get them the care and the attention and the services that they need. But in the back of your mind, you know that this is a lifelong journey. You know that someday your little girl is going to be 18 or 19 or 20 years old, a college student with all the same hopes and dreams and wishes of any other young adult their age, and all the same medical issues and complications and special needs that they have today. I believe that this bill is an important first step. I want my daughter to have access to the same kind of college and university experience that my other 2 children could have. But that will mean special accommodations for her monthly infusions, for the side effects that come with them, for the neuropsychiatric symptoms that develop with a flare. It will mean some help to navigate the medical needs, dorm living, career planning. I think having a point person to help navigate those parts of the system could be life-changing for my daughter.
Thank you, Ms. Colantano. Is Ms. Andy Culp, are you here? Why don't you come up and then we'll take questions. That'd be great. And we'll take questions for the proponents. Then we'll go to Dr. Bauman, who's in opposition. Ms. Culp.
Great. Thank you, Chairman Pinsky and members of the committee. Again, for the record, my name is Andy Culp, and I'm here on behalf of the ARC Maryland in support of Senate Bill 832. We believe this bill promotes inclusion and equity and accountability, and is a critical step in ensuring equitable access to higher education for individuals with disabilities and chronic healthcare conditions. Students with intellectual and developmental disabilities have some of the lowest rates of both competitive employment and college enrollment compared to other disability groups. However, students with disabilities, intellectual disabilities, who complete an inclusive post-secondary program achieve better employment outcomes, expand peer and social networks, and ultimately increase independence. As pointed out before, so I won't go into a huge amount of detail, but the 2021 Maryland Higher Education Commission report focused on part of the report on students with disabilities and notes that in fiscal year 2019, over 15,000 students, undergrads, were registered with their institution's Disability Services Office as students with disabilities. So while this number seems pretty large, it's actually just a drop in the bucket when you compare it to the number of students who actually have chronic health conditions and disabilities who haven't self-disclosed. Because, you know, my son falls into this category, and for the last several years, we have been his unofficial case managers in helping him navigate the school system in Maryland, and thankfully that he's successfully coming to an end of his college. But it's not like that for everyone. Not everyone has those supports, and so case management would be greatly beneficial to people who don't have educated and experienced family members to help them out. So I'll wrap up my testimony just by saying that by providing case management for students with chronic healthcare conditions, we think that would take Maryland another step toward equitable access and opportunities for all. And so for that, we ask for a favorable report on House Bill 832.
Nice timing, Ms. Culp.
Thank you.
Could one of you move back a row so we can have the sponsor, Senator Feldman, come back to the table? I think there are going to be a couple of questions. Senator Washington, followed by Senator Carosa, followed by the chairman.
Thank you, Senator, for this bill. I have a nephew on the spectrum who's about 2 years from getting ready to start looking at college, and so thank you, the timeliness on this. Also, thank you all for testifying, and sorry we have not, as a state, provided for you, and thank you for being a part of making sure that we can do a better job for other young people. So thank you so much for your bravery in your testimony and your continuing to fight. I had a question about, and since you're on the appropriate committee, would schools or insurance, is there some way that this could be a billable expense? In other words, since it's related to a diagnosis, would they, because that's always part of the issue, right? School systems are also, well, who's going to pay for it? Would it be able to be, do you think we could consider that?
Senator
or-
Washington, I mean, you're posing a question that I have to say I have to think about. I'm
Well,
not
let's just think
sure
about it.
within this lane. I don't have an answer.
Yeah, so
but, yeah.
that's something that occurs.
I mean, since the doctor is sort of expert in this field, she probably is better even able to answer it than myself.
Because I know we've done some of that in providing behavioral health in some of our schools. They've been able to have someone resident, and then that person is able to bill, and then they're able to get some services that they wouldn't.
I think that's a really important question, because one of the things is that when these young people go to college,
Right.
there is sort of that handoff on where they're getting their health care.
Yes.
And so that's a big gap that the healthcare community is certainly looking, trying to understand, because a lot of these kids move out of state
Yeah.
and they leave their pediatricians. So I think that it makes a lot of sense that, to think of that angle, especially because, the payers are looking at behavioral health conditions. And ultimately, it's all intertwined, their health and their education. So I think that it's a very good suggestion.
Okay, and then on the other side, do our high schools, when we're transitioning them from high school and making a choice about which schools have better supports and which don't, and is there a ranking at all for us to be able to guide places that are better suited? Yeah.
So actually, I know, because one of the things is the transition from school to post-secondary
Right.
life doesn't really do a good job for the health condition community. So one of the recommendations that's coming out from the National Healthcare Transition Center is to include health in the transition process before they leave high school. So that's work that needs to be done, before they finish high school. And in terms of colleges or institutions that support this, there's no information that's publicly available. Our National Policy Working Group, through that, I'm finding that there are colleges that are doing that, but they're mostly smaller schools that, smaller schools up in the Northeast. But it's, I think it's a wave that has to sort of take off.
Okay, thank you. Again, thank you, Senator, for this bill.
Thank you, Senator.
Thank you.
Senator Carosa.
Thank you, Mr. Chair, and Senator Feldman, thank you for this bill, and I want to thank the witnesses for your testimony and for bringing the stories straight to us. And those of us who have family members with chronic health conditions are also sensitive to this. Obviously, there's a lot of time has been spent on this. If we've done a report, you all have testified in the past. And,
But can I just add, Senator, I don't mean to interrupt, but one thing, look, we picked out for this bill one of the 17 recommendations or whatever. I mean, if you look at that report and you think there's merit to us doing something, feel free to plop one of those other things into this bill. We took I thought, the bare minimum approach here because, but feel free to look at that report.
I appreciate you took a narrow approach as a first step.
Yeah.
And so I guess, and I did see that at this point, we have the University System of Maryland not on board yet. And I guess I wanted to ask you, Senator Feldman, because I've worked with you on other issues, you have a way I didn't know if there's been some back and forth that instead of just looking at maybe why this can't be done, if there might be a way, working with the University System of Maryland, to look on, maybe can be done a different way. So for example, I know that we have athletic counselors we have academic counselors for our student athletes at University of Maryland. And look, and I fully support that. I played sports in school, so I fully support that. But it just seems to me there should be, if they're having that type of support, because we want to make sure those athletes, many that are not going to be professionals, that they have a career track when they graduate. It seems to me that we could work out some type of support for students, no fault of their own, that are experience these chronic health conditions, so they can be, again, successful. You don't want, and graduate and move on. So I guess my question to you, Senator Feldman, have you had sit-down conversations with the University System of Maryland to maybe talk through on how?
Yeah, no, look, so number one, I think they're here. I have not seen, as of this morning, I haven't seen their letter of opposition, so I don't know the nature of their opposition. Okay. What I do know is they were a member of the very work group that produced the report. So, clearly if they had concerns, I'm sure it was vetted there. We, as I say, so they were part of the work group that produced a report that came up with recommendations. I have not seen the letter, what their concerns are, why this isn't feasible. So I look forward to seeing the letter, but I, as of this morning, hadn't received that. So okay. I look forward to hearing what the practical problems are.
Thank you.
And let me ask a question, Senator. And I understand taking first steps and getting pushback when it's too bold. I continue to learn that lesson after a number of years up here.
Yes, I'm sure.
But I'm looking at the statistics, and I look at a large university like Towson or College Park that may have some thousands of people who fit in the category of chronic health condition. And I'm trying to understand or imagine the implementation of having a case manager for some fairly significant large number of people and what that'll look like, to be honest with you. And again, even getting this on the radar screen is important because it will recognize this as being a problem. And I know there's some institutions in the DC metro area of Virginia that do better at this than others, that have been welcoming to people with disabilities, for example, in terms of housing and support and job support, et cetera. But at a big campus, how does this play out?
Well, look, I look forward to hearing the testimony. As I say, I'm not, the expert. I think the doctor probably may have some thoughts on that. I assume, I haven't seen their letter, but I assume you've summarized, their concern about implementation. I don't know, but
basically,
yeah, I don't
take Dr. Bauman's.
Yeah.
I mean, she says they have programs, disability centers. They hope those people with needs come to those, register and get supports. I don't know if they mentioned the additional PIN for each of the campuses, but I think sub rosa, that's a concern of taking another PIN that won't pay for itself. But again, I don't want to take words out of her mouth.
Here, why don't we do this? Are they testifying? Are they? Is anybody testifying from the university system? Okay. So look, I'll listen to her testimony, and then maybe, we can have some additional conversations about implementation. I can't, beyond that, Mr. Chair, it's hard for me to comment without having seen their letter of concern or.
Thank you. Thank all of you for coming today, joining us and sharing your testimony. Thank you, the younger Ms. Baguette, for your testimony and what you've gone through. Thank you all.
Thank you.
Okay, we're going to move to the opposition. Dr. Bauman representing USM. Your name has already been taken, hopefully not in vain. So we're interested to hear your comments, Doctor. Thank you.
Thank you very much, Mr. Chair. As he said, my name is Dr. Joanne Boffman. I'm the Senior Vice Chancellor for Academic and Student Affairs for the University System of Maryland. Indeed, we did have representatives on that work group to describe some of the challenges before us. Our problem is the language of the bill is written in such a way that it's going to be nearly impossible for all of our campuses to implement. This is one of those cases where the devil is in the detail. The challenge we have is the fact that case managers who would sit inside the health center for those campuses who actually have a health center versus the disability services offices that know all of these other support systems. It is the relationship between the two and the way they might and must share information that, in fact, even the member of the committee that made this recommendation has concerns about the possibility of violating HIPAA and/or the privacy of individuals within the health center and treatment process. We strive to inform all of our students of the services that are available. We know we can do better, and we appreciate being challenged to do so, both in informing and providing those services. What we would like to propose is working with the sponsor of this bill and others to craft language that, in fact, would allow us to implement on all of our campuses, not only those with large health centers, but those that don't have on-campus health centers, but still need to be able to provide some services to students in a manner that we, in fact, could comply while protecting privacies. Let me just summarize by saying, as it is written, we must respectfully recommend an unfavorable report, but with the stated hope that we could work together to find a way to serve all of these students in the way they deserve to be served.
Thank you, Dr. Bachman. And I'm sure the sponsor is more than happy to hear you'd like to have an offline conversation
Absolutely.
and get to yes. I mean, if a student wanted their name to be entered to get the services, obviously they could do a limited HIPAA release.
Yes.
So whether the Disability Center or some other support knew about their disability to provide the service. I mean, there's a way forward.
There is a way forward.
Okay, thank you. Other questions? Seeing none, hopefully that dialogue can continue so we can, I did have if the services can't be provided now in a sufficient way, paying for a case manager, and I don't know if that gets to definitions of whether you think you have a case manager who will take on additional responsibility, but if in fact it calls for a case manager, which the physical note puts at $76K, that won't be an obstacle, or it may be?
It would be a real challenge, especially for some of our smaller campuses.
Okay. We urge you to get together and come back to us with some suggestions when you can.
We appreciate the opportunity. Thank you, Senators.
Thank you. That concludes the hearing on Senator Feldman's bill. I'm sorry. Somebody? Okay, we're going to move to 717, Senator Simon Ayer, Virtual Education Days Authorization.
Thank you, Mr. Chairman. Senator Brian Simon Ayer for the record. I was going to have Senator Rosenpep with me. We're doing this and it's a bipartisan, but he couldn't get out of committee right now. As we know, COVID really introduced us to Zoom. And many of us are very tired of Zoom, being on Zoom all the time. And we like to be in person. But that being said, Zoom does have its benefits. Like if I want to meet with somebody in California, or if I want to meet somebody in Eastern Shore, I can just do a quick meeting. And that being said, COVID really changed our educational system as well. We abruptly were forced into a virtual environment. We had some growing pains, but there were also some benefits with that. And that brings me to my bill, Senate Bill 717. Working with the board and MSDE, they are favorable with amendments, and I looked over the amendments and I'm fine with them. I think it improves the bill and clarifies some things. In Anne Arundel County, we have a calendar and you have so many snow days on it. We've already used up those all. And the kids are going to get out June 24th now, as is. And if they get more snow days, it could be the end of June or go into July. So what this bill would do, it would be an option. It's not a mandate. It gives schools, local schools, the ability to set up a virtual environment during severe weather problems like snow. So what this would do is it gives the authority to the locals, and they would set up that their supervisor could authorize this. Again, it's not a mandate. But if they do it, they have to have a public hearing and a public vote on this, so they get public comment for their jurisdiction if they want to do this. And it would only apply after they've used up all their calendar allocated snow days or those type of days. The notification process would be similar to the closures currently. But the thing is, they have to design this before they implement it. That's key to that. So they're ready to go. They use asynchronous and synchronous instruction. They have to make sure everybody has easy access to the internet. And then again, like I said, we will take MSDE's and the board's friendly amendments to do that. And just as a side note, right now the MSDE can approve this for locals. As in their testimony and some of the local ones, they say some of it's confusing. This would take it from the state level and bring it down to the local level where local control would have it. It would standardize it. And with that, I will conclude.
Questions for the good senator? Senator Gallion.
Thank you, Mr. Chairman. Thank you, Senator Simon there. I had a similar bill 2 years ago, and I'm glad to see that, you got MSD weighing in this time. I think last time, during the hearings and stuff, we kind of heard that this was a solution searching for a problem. Well, then within a couple weeks, we had the issues, when the schools closed down and all. So I think returning this to the locals is a good thing. And, I'd like to see us be able to get away from snow days pretty much altogether with this. And then you could really work, on those calendars when you're trying to figure out where it ends. It would be a little bit more set in stone without having that extra wiggle room. So, but one thing I wanted to bring up a question in the bill from a couple years ago, we talked about stuff like blizzard bags and having so much time to be able to get work done. So that way, students who had issues with internet connectivity, which we're trying to work through that stuff, I know with broadband and whatnot. But is that something that you kind of looked at, options for folks that have issues with internet accessibility?
This does not go into that detail, but it says you have to have it in place where everybody has access to the schooling. You can't do it until everybody would have access. So the actual specifics, how they would do that, that's left up to the locals.
Okay, thanks.
And just as a clarification, there were 16 jurisdictions who applied, I believe 16, to the state this year, and it's good for 1 year. Again, this would bring it down to the local level. MSD is good with it, so I think it's better at the local level as well.
Okay, and I would encourage people to look at the amendments proffered by the state superintendent.
Yeah.
And you're fine with those, correct?
Yes.
Okay. Okay, thank you. That concludes the hearing. There's no one signed up. Well, there was an individual signed up in opposition, but not oral testimony. Okay. I'm sorry, who? Okay. I wanted to move Edwards, but if Edwards wants to come before her, Senator Edwards, we could just knock him out real fast. If he can run down here before she can.
He said, is the proper on Sunday?
has a bill, and he's the only testifier. Yours have a bunch, so if he's down here in the next 2 minutes, we're going to take him.
Whatever works for you.
Okay. Senator Edwards, you're going to be the head of the class today. We don't want to keep you. It's a fairly precise bill, which may be similar to another bill we just heard. Senator Edwards, welcome to EHE.
Thank you, Mr. Chairman, Vice Chairman, Vice Chairs up in our committee. So, members of the committee, thank you very much. Yes, you heard this. I think time flies by. Last year, the year before, Senator Simon Ayer had a bill, and I haven't looked at it yet, but I understand they might be pretty close to being similar. I'm here to ask for your support for Senate Bill 848, which would be a pilot program. And it's my hope that between this bill and the Senator from Anne Arundel's bill, we really need a program like this in this state as far as I'm concerned. Impacts my part of the state considerably, because we usually end up having way more days off because of weather than any other part of the state. It sometimes has to go to the middle of June or the latter part of June, which impacts our students and getting jobs, etc. So this would be a pilot program that will go to September 30th, 2024. The superintendent would have to notify that there will be a virtual day and make sure resources are available for everyone. Usually it would be a couple of days in a row, and probably wouldn't be the first day, so they have time to notify everybody. And mainly it would be for severe weather or other emergencies to be determined. This would impact the number of days on the calendar, so they could do a virtual and not get counted as a day and wouldn't put them off into the future further, for a better way and simpler way to say it. And then at September 1st, 2024, they have to give a report to the appropriate legislators. If I might, Mr. Chair, I did contact our superintendent this morning, and I don't know what the state board's doing, and I can't remember if we passed the bill had in before for a year or two to allow a little bit of time to try it. But I just want to read a paragraph, because I know they're working with the state board. It says, as to whether we still need this bill or not, I'm not sure. We did submit a plan to the state board and MSDE that was approved for this year only. 2 weeks ago, they called school off on Thursday and Friday. They called it off on Wednesday because of a pending ice storm, which they knew was coming, and it was supposed to be a pretty big weather situation. So they called the 2 days off ahead of time. And we did call 2 virtual days last Thursday and Friday. Well, there were a few glitches, particularly with the younger students and their parents who had not experienced virtual learning before. But all in all, most of the response was positive. The attendance was also very good. Approximately 94% on Thursday and 91% on Friday. This is likely better than we would have had a day in late to mid-June. Now, having said all that, the state superintendent has not given us an indication as to whether the virtual option will be granted to us in the next school year. So it works. Now that we've had a year or 2 years, basically a virtual everything, the stuff's in place. the two counties, this would be for Allegheny and Garrett, have the knowledge and have the wherewithal to do it. And I would ask for your support. I know last year, Mr. Chairman, or whatever year we had this bill, someone talked about making it statewide. I don't care. Might be the thing to do. But I can tell you, and some of you know in here the weather conditions we get, that we get school called off a lot more than any place else. And it's hard for our kids when they got to go to the middle of June or the end of June to make up. And I know someone will say, well, get a waiver. Well, you got to ask for a waiver, and sometimes it's very difficult to get waivers. So technology's changed. It's a little different scenario than it was 2 years ago. So again, I would ask for your support of Senate Bill 848.
Thank you, Senator, and it is very similar to what we just heard from the Anne Arundel County Senator. It's basically the same thing but statewide. So we will look at both of them in tandem. I think the committee's sensitive to that issue, so we appreciate you putting this in.
You all have some good people in here and know a lot more about education than I do. And if you think it's a worthy project, put something together that works for everybody, that'd be great.
Thank you, Senator.
Thank you, Mr. Chairman, members of the committee.
Okay, ladies and gentlemen, we're going to move to Senator Elfreth, back 12 hours later. We'll start with, which one do you want to start with, Senator?
Oh, gosh. Whatever the chair would like. They're both great bills.
Well, is that Ross?
Yes.
Which one are you on, Ross?
501.
Okay, we'll take 501 first.
Okay.
This is Higher Education Commission procedures alterations. We also have Joe Fisher and Deja Cobbs. I don't know if either are here today. Is that Joe? Oh, good to see you. Please come up. Senator Elfreth, you can lead off.
Thank you very much, Mr. Chair, members of the committee. Here to ask a favorable report of Senate Bill 501. Like all of you, I received countless emails from constituents and community groups across the state during the interim. In this fall, I received 2 separate communications, one from University of Maryland and one from Towson University, their financial aid advisors saying, hold on, we have a lot of students who are receiving the notifications of their need-based scholarships from EHE the same day or the day before they have to make their college decisions, which is not providing enough time, in my opinion, for young people to make what is going to be one of the most consequential economic decisions of their lives. So we went to EHE, and I serve on the Education, Business, and Administration Subcommittee of the Budget, so have a great relationship with EHE, went to them and said, can you please fix this internally? Can you try to move that award notification date up to enable students to make these decisions? Respectfully, they came back and said that that was not a possibility, given all of kind of the machinations behind the scenes that they needed to make appropriate awards. That is perfectly fair, and I will share with this committee the more I've learned about this problem, the more I've had the secretary of EHE in front of my budget subcommittee and asked him repeated questions about this problem, kind of peeling back the layers of the onion here. There's many contributing factors to the delay in notifications of student awards. This bill attempts to tackle one of them by simply moving the date of the award notification up to April 15th. And it also says, like many of our other public institutions, that EHE has to live stream its meetings, the board, and archive them so future folks could watch those meetings. So that's what the bill does. But as I mentioned, we have this onion problem, and there's many contributing factors to EHE their delay, let's say, in notifications. One of which I learned in my budget subcommittee just last month. 97,000 applications were submitted last year. EHE has 16 staff to go through those applications. So we have a bit of a staffing challenge, but we also have a major technology challenge. MD CAPS is the system that we're using. About a decade, in my belief, old. When I asked the secretary about this, he admits that we've had to, every new scholarship the General Assembly creates, we've had to kind of Band-Aid the system. So we're using an antiquated system, and we're using a system that, frankly, needlessly requires that the students send multiple paperwork, multiple forms of verification back and forth, when we could all along
authorize MHEC to cooperate with the Comptroller's Office to verify income of families. So we could skip many of these steps and skip much of the time that MHEC is undergoing to make these decisions. So again, the more I've learned over the last couple months, the more work it's clear that we have ahead of us as a body to ensure that Marylanders can afford higher education. So the bill before you is, I'd like to believe, a starting place, and I feel like I'm a broken record in EHE this week, bringing you bills that still need a little bit of work, but I will like to ask that we together think about how we can further require MHEC to seek that financial matching information with the Comptroller's Office. You have a letter from the Comptroller's Office in your packet that expresses they want to be a part of the solution here. And again, that will save a significant time and a step for everybody involved. And I also like this committee to think about, in the future, in the long term, how do we build a better platform in which students can more easily apply for these scholarships. Part of the issue, students have to apply individually for each scholarship instead of sending one application and checking boxes they think might be appropriate. So there's just some structural challenges we have with this issue, but I know this committee has been committed to affordable higher education more so than most people, and I appreciate the consideration of this bill as a starting place, and let's continue the conversation to meet the goal. And with that, Mr. Chair, I request a favorable report.
Thank you. You can proceed in whatever order makes sense. No, we're going to take questions after all the presenters. Mr. Stern, you can proceed.
Mr. Chair, members of the committee, my name is Ross Stern. I represent the University of Maryland. I'm the Director of Government Relations for the university. I am not the Director of Financial Aid, nor do I play him on TV. Unfortunately, due to a scheduling snafu, he couldn't be here today. But he would like me to emphasize to you that it is extremely difficult to make a decision on where you're going to matriculate to university if you don't know what your potential GA or guaranteed access or Howard P. Rawlings scholarship award is going to be. We're putting students and families in a really difficult position if they find out on May 1 and in some cases after May 1. So I think we want to thank Senator Elfreth for looking into this issue and thinking about the importance of allowing students and their families to make an informed decision. Again, this would give them about 2 weeks, which, you know, many other states actually make their announcements much earlier than April 15th, but at least they'd have some time to think about where they would attend and what makes the most sense financially. I do also want to say the part about recording and making the recordings of the MHEC meetings available would be similar to what you require the USM Board of Regents to do right now, and it seems fair. And sometimes, you know, we can't all watch the hearing or listen to the hearing at the time of it, and it would be very helpful for all of us in higher ed if we were able to go back and watch those hearings later. So with that, I ask for your favorable report.
Thank you, Mr. Stern. Either Mr. Fisher or Ms. Cobbs, in whatever order you choose.
I'll let the young lady go first.
Thank you so much.
What a gentleman, Mr. Fisher. Thank you.
Hi, Senator Pinsky and committee. My name is Deja Cobbs, and I'm the Director of Program Services at First Generation College Bound. I'm here in support of Senate Bill 501 regarding state grants awarding before May 1st. Many students we work with deal with the challenge of waiting to see if they will be awarded a state grant before making their college commitment due to MHEC processing of required documents. As you can imagine, this can be challenging as a senior figuring out what school is best fit for them by May or between June 1st. Each year, FGCB has to follow up with MHEC to inform our students of their status based on documents required to turn in for grants. Returning college students who receive state grants have to stop attending school because their financial aid has not been approved in time. We see students unable to matriculate to college because many may depend on state grants like the Guaranteed Access Grant, which covers the direct costs. It is sad to see a family anxious and worried after they have done all that they can do while they wait in anticipation for an answer. Having an earlier notification for this allows the student to focus on what really matters, which is being academically prepared.
With this, we also want to be sure that they have an early notification date that does not impact the guaranteed access grant students. This will also support the GA grant students, being that the money would still be reserved for those students. FGCB supports Senate Bill 501 with funds being reserved for GA students, knowing their state grants are secured in time for a new school year. Thank you.
Thank you, Ms. Cobbs. Mr. Fisher.
Well, everybody, I'm all fired up here. What I just heard. Senator Penske, I can't tell you, Chair, and the State Senator, I appreciate all that you do for the people of the state of Maryland. I've been on this journey of financial aid, leveraging state and federal aid for kids to go to college, graduate, little or no debt, not raising scholarship. You are the key, the state of Maryland, for our success, in which most of our 940 achievements for higher education is due to the financial aid from the state of Maryland. However, that has come with challenges, and you have addressed that very well, Senator Alfred, because what we're talking about here is the infrastructure. You need an infrastructure in place to really, for this process of being on time, to work. And I think that you have dug deep in terms of helping out with that process to eliminate the documentation needed, especially for needy kids. I'm very passionate about this, and please understand, I come from a home, mother, 6th grade education, father, 10th grade education, one of 8 kids who wanted us to graduate high school only. But we went on to college. I was blessed, growing up in poverty, coming not only from the projects in D.C., but working in the tobacco fields of Charles County and Welcome, Maryland. And 41-year coaching at Catholic University today, and 35 years teaching. My parents and my kids have the same hopes and dreams for their kids, but they need the same quality of service for their kids to achieve higher education. We are seeking a favorable report for the research to be done to get this right, because Maryland is on track to get it right, and we want to be in support to make that happen. So we're requesting a favorable report for Senate Bill 501.
Thank you, Mr. Fisher, a longtime proponent and a hard worker in Prince George's County and many places in Maryland to help, starting in middle school and high school, to get kids to want to go to college and get the money for them. Senator Freyhester.
Thank you. My question is for the sponsor. I really appreciate this bill. You hit on 2 themes that we've heard throughout the first, half of session in terms of lack of staff and antiquated IT systems. Yes. Everything from septic systems in the Department of Health to now, loan grants in MHEC. So my question is, did you get any detail on the actual technical problem in the comptroller's office? Is it because PHMSA is so old, or is the problem in MHEC, or is the two don't talk to each other?
The problem is it's the MHEC system, MD CAPS, the system that they use. I believe it's about a decade old, and every time we pass a new scholarship, they have to do an amendment, budget amendment in the Board of Public Works to add the infrastructure to the platform for that new scholarship. So it's very much a band-aided platform. And it is not capable of communicating with the comptroller's office, which we believe would save significant time and significant effort on behalf of the applicants.
I think the comptroller's office is at least 30 years old. so when I come to B&T on you, thank you.
Yeah, and I would say, and Senator Alfred and I have talked about this, MHEC has been a lost agency for many years, in my opinion. You don't have to affirm that. Understaffed. I could use a number of other adjectives. I won't. It has not done a lot of the job we would have hoped. And again, you have a big USM, a big system. In many states, it's the Higher Education Commission that runs the computer system. But here it's USM, so you do have a situation where the tail is wagging the dog. And it's been under many governors. I don't want to put this just on the Hogan administration. It has been a lost child, unfortunately. And one of these days, we're going to figure out a way and a plan. And there have been efforts over the years to deal with K-12 and higher education and community colleges and have a more systematic approach. But we've not yet get a handle on that. So it's been a problem. and I think we understand that. Isn't that so? Okay, seeing no further questions, and no one in opposition, we thank all of you. Thank you for all your fine work that you do. Thank you.
Thank you.
We're going to move on to Senator Alford's second bill, also in higher education, transfer platform established. We have the senator, lead witness of Brad Phillips from MAC. We have Mary Bolt and Antoinette Coleman, who will then be followed by Ms. January.
Okay.
And again, I don't see any opposition to this bill.
Okay.
So if we can, we want to hear what you have to say, but let's try and be additive.
Okay, thank
Senator
you.
Alford.
Thank you very much, Mr. Chair. Committee, very proud to present Senate Bill 540, Higher Education Transfer Platform, establish the Transfer with Success Act 2.0. This committee had the wisdom to pass the Transfer with Success Act last year that directed a number of better lines of communication between our community colleges and our four-year universities to ensure a smoother transition for our two-year university students. That was step one, and I am so proud that the stakeholders have come together over the last number of years, community colleges, university system, and MICUA, our independent universities, have come together and really taken that direction to heart. We have an ARTSYS platform, and if the vice chair were here, I was prepared. It is actually not an acronym. It is a fun computer name that's Articulation System of Maryland's Colleges and Universities. ARTSYS is the platform that will allow, if I'm a community college student and I want to study nursing, let's say at Anne Arundel Community College, ARTSYS will allow me to check if the classes I am taking in my nursing platform would transfer and what grade I would need to achieve at, let's say, a Towson University's nursing program before I even took that class. So this would create, once up and running and once fully funded, the ability for those two-year university students from the beginning of their community college journey to have a vision and a pathway towards their four-year college and further success. So the ARTSYS program is up and running. I'm so proud that all of the community colleges in Maryland, all of the University System of Maryland schools, and a good number of MICUA institutions are already participating in it. What Senate Bill 540 does, with an amendment that you should have attached to my testimony, builds on the success of last year's legislation, and it requires the creation of the transfer platform that already exists, but we want to put that into state law. It authorizes private non-public institutions to opt into the program, which they're already doing. It clarifies that institutions need to put into the transfer platform certain information, including the ability for students to establish an account, allowing access to saved searches, providing transfer programs for near completers, providing reverse transfer accountability for students, providing admission requirements for institutions, and the ability to compare courses which students seek to transfer. Lastly, the bill requires the funding of ARTSYS at $1 million for the creation and maintenance of the platform. We just spoke about the need to invest in our digital platforms as needed infrastructure. And I'll just end, Mr. Chair, on the note, I care deeply about higher education, as this committee does. I serve on the education subcommittee of the budget. I truly believe that this bill and this platform will save students, families, and the state of Maryland hundreds of thousands of dollars, if not millions of dollars every year, in a more efficient and streamlined transfer process. And with that, I respectfully request a favorable report.
Thank you, Senator.
Thank you.
Also a student member of the Board of Regents. Yes. Okay, Mr. Phillips.
Good afternoon, Mr. Chairman and members of the committee. My name is Brad Phillips, and I'm the Executive Director for the Maryland Association of Community Colleges. I, too, want to thank Senator Elford for her work on this continually from last year to this year, and also thank the two sponsors on this, co-sponsors on this committee, Senator Hester and Senator Riley, for supporting this legislation. Seamless transfer continues to be an initiative for Maryland's community colleges, and all 16 community colleges strongly support this legislation. And Mr. Chairman, work goes back as far as the College Completion and Career Readiness Act of 2013 on this issue, and as last year as well. We're making progress, but it still continues to be one of the biggest sources of frustration for transfer students. And it's actually one of the most stressful aspects still for when they leave one institution to go to the other as to what and how their courses will transfer. When they don't transfer as expected, it becomes an equity issue for our students as they have to retake a course. It extends the cost from the state and their time to earn a degree. But this legislation, however, will for the first time acknowledge and fund the technical component for a truly statewide transfer platform, which has the potential to be a significant game changer for students in two ways. You've already heard from Senator Elfreth as to how it will help students navigate, but it also, from an institutional perspective, will help provide the framework for all institutions that are participating to upload their course material, have it reviewed, approved, so students know that the information that is in the system is up to date and will transfer. Ultimately, the legislation provides the funding as well for students to have this transfer platform. And as you've already heard at the beginning of your hearing today from the Senate President himself, what makes Maryland so great is its investment in higher education. So we certainly agree with that and hope that you pass this legislation with a favorable report. And I'm here for any questions. Thank you.
Thank you, Senator and members of the committee. And I would also really like to extend a really big thanks to Senator Elfreth for she and her co-sponsors for this bill. Senate Bill 540 is going to make a tremendous difference in the lives of our
Ma'am,
students.
for the record, we're being streamed. Could you start with your name for the record and
Yes.
any organization you represent?
Yes, my name is Antoinette Coleman. I'm the Associate Vice Chancellor for Academic Affairs for the University System of Maryland. And as I said earlier, this bill is going to be a tremendous help to all of our students in the state of Maryland. My colleagues have spoken about the reason why students need to have this bill in place. It's the responsibility of Maryland's four-year public universities and community colleges to provide Maryland students with a high-quality, affordable, and intentional education that will prepare them for fulfilling careers. ARTSIS does that, and ARTSIS has been supported by the USM system for 30 years, and it has collaborated with the community colleges, MICUA, Morgan, St. Mary's, over the years to build out the platform. But as we all know, the higher education landscape is changing, and therefore we have needed to upgrade ARTSIS. And to ensure that our students do have the seamless ability to transfer, we are asking for your support for the transfer platform to be funded by the state. Currently, as we are upgrading ARTSIS, we are finding that many of the costs for our institutions have become tremendous. Our students need this platform. They will be able to ensure that they have reduced the loss of credits, costs, and time to degree. The General Assembly's annual appropriation to support and sustain ARTSIS is so greatly welcome. The USM is in favor and would ask your kind support of SB 540. Thank you.
Thank you, Mr. Chairman. Good afternoon. My name is Mary Bolt. I'm the president of Cecil College. I'd like to also thank Senator Elfreth. I really see this challenge. This is really an infrastructure problem that we need to address, and I think that the senator's bill certainly helps address that. Community college students often are part-time students. 65% at my institution are part-time students. They work. They're also taking courses at multiple institutions, some face-to-face, some online. They really need to know before they pay, is that going to transfer where they want to end up having their degree conferred? When we're not able to do this, our students lose time. They lose a significant amount of money. And when we have this issue where students cannot transfer in the manner that they had expected or efficiently, they don't reach their anticipated degree goals or their certification goals. Taxpayer dollars that have been invested in higher education may be wasted. Communities and employers don't get the workforce they need, and our economy suffers. And I really believe that this is an infrastructure that needs to be enhanced and really supported, because if we are truly believers that Maryland higher education institutions are top-notch and they lead the nation, we need to show through the support of this simple infrastructure to ensure that there is seamless transfer between community college to four-year institutions, and four-year institutions to community colleges. So I urge your favorable support of this bill. Thank you.
Thank you. Why don't we have Ms. January, and then we'll take questions. If one of you could step back just for one row for a couple of minutes, that'd be great. Ms. January from MACO.
Thank you, Chair, esteemed committee members. It's good to see you all again. Brianna January, for the record, with the Maryland Association of Counties, MACO, in strong support of SB 540. As always, you have my written testimony, and in interest of time, I'll be very brief. You've heard what this bill will do, and counties strongly support the merits of the bill. As you've heard, and I won't repeat it, but there do remain several problems associated with transferring of credits between our 2- and 4-year institutions. And to be frank, committee, these bottlenecks really do waste money for both money and time for both the locals and the state as we collaborate to support our community colleges. And for these reasons, MACO urges a favorable report from the committee. Thank you.
So thank you for this bill. I actually was working on a bill to have the credits that are taken in our correctional facilities transferred into our community colleges 4 years, and came up with a huge problem. So I decided not to put that bill in. And so there's the technical issue, but I'm wondering, have we addressed the course transferability issue? Is there a master MOU? Because that's what we realized, there'd have to be a master MOU from USM to accept all of them, and or does it have to be on a school-by-school basis? So before we even do the technology of it, because that does also affect, but is there that?
We don't have a master MOU, but we have articulation agreements.
Okay.
Because each program varies, like our professional programs
Right.
have certain requirements driven by the accrediting bodies for those programs. So in arts is currently, as we talk today, there are 850 articulated programs, which are programs where the community colleges and the four-year institutions have agreed that the curriculum that the student takes at the 2-year, the community college, their pathway into the upper level courses at the 4-year for a given program.
Right.
For example, let me give you an example. Popular psychology. They take the required general education courses at the 2-year and maybe a 200-level psychology course that will help them as a prerequisite for 300 and 400. Students take that, they transfer those credits into the upper-level courses. The key here is that the institutions have done the work to say this is an articulated pathway.
I guess if we're talking about a program, right, then there'd have to be a so I just want to be clear. So all of the USM schools and programs and courses have been translated into articulation agreements for all of our 24 community colleges? Or we don't have 24, but we have, 20.
Okay, what we have in the system is there is Morgan, St. Mary's, USM, and participating MICUA institutions.
Okay, all right.
And what all of the institutions have said is that for these programs, which are at 850, and I cannot say that that's every program with the school, but 850 programs among those schools, there are articulated agreements. Now, this is only for undergraduate programs.
Okay.
So these institutions and community college, it covers basically all of the programs that the community colleges offer that would articulate, as we would put it, to a 4-year program.
Okay, I got some
And it's
info.
different
So,
than if you're talking about the credential programs that the community college offer. The
Okay. Yeah, help.
No, in fact, Senator Washington, I'm really interested in hearing what technical difficulties you had when it came to instruction being offered in the correctional facilities, because we do a number of that as well.
Well, no, it
And
would be accepting if a
We're
credit.
going to hold that.
Oh,
We're
sorry.
not going
No,
to get
no, no.
into
Yeah, I don't
the.
wanna-
Sure,
Yeah,
I didn't mean to right
Yeah, I
now,
just,
but
no, but the technical part, that's why, so that I understand that there is a piece of it, and why I raised it, is that a piece of that had to do with, you didn't have enough, the lack of computers,
Okay.
so this is Warwick, for example. We were looking to see how can we translate some courses that are currently being taken at Eastern Correctional into Warwick. So I just want, so that technical so there's a similar, you're saying there's a similar technical problem for the system as a whole to take those classes from.
well, I will say this, Senator, that we've been using ARTSys for a number of years, and we're in the process of doing an enhanced version of that, which has prompted the cost.
Yeah,
And that's why we're coming to this state, because we've never had this in our base budgets for students to leave our institutions and pay
Yeah,
for a
no,
system
I
for
think
them to
it's a
do
great
so.
idea.
So this will really help.
I'm just happy that it's just, I was just clear that it's just that there
Sure.
are already agreements between community college and the USM system that your courses are matching up, and so we don't have to do that part.
Correct.
All right, great, thank you.
There's, Senator, I'd like to add, with the correctional
Briefly.
with the correctional institutions, if they take a course at Warwick
Yeah, yeah.
and those students in the correctional system,
Yeah.
those courses will transfer.
Yeah, Warwick, I wanted it to be everywhere, no, but it's,
Just quickly. Thank you, Mr. Chair. Just want to share a little bit of information with Senator Washington. And the rest of you, you're absolutely right. I submitted a bill last year, and it was passed, Senate Bill 800, where I wanted the correctional center to come up to par with being able to put in technology, whatever, to get it off and going. And what happened, I discovered that somehow the correctional center didn't really want to do it, but we were able to put a bill in, and a report is due about June 30th that will tell us how far they've gotten, hopefully completed, such that we can do some of the type of things that you were talking about. And it was being done in cooperation with the 4 HBCUs. Thank you.
Let me ask a question. And I was somewhat involved in the college and career readiness of 714, and this committee passed it. And back then, we tried to get common numbering or some way, shape, or form, because there were challenges and battles between a community college and this four-year college. The class was not up to snuff. So do I understand this common platform as saying that if, and I'm going to use an example of Algebra 1, and I shouldn't use Algebra 1 and Algebra 2, but in other words, if Course X has been taken, no matter where it's taken, that will be counted and allow them to go in Course Y, which is the next level up? Again, I'm trying to understand
Yeah.
a common platform versus common numbering. And again, we don't have to create a program to do this. And we know, and I think Senator Washington was referring to it, we've heard calls from community college students, they rejected X credits. I wanted to go, whether it's Towson or College Park. They said it wasn't quite the same. Some of us felt that, some people felt it wasn't serious enough, or it didn't meet the high standard of that institution. And we've been trying to reduce that tension. I mean, that's been our belief and our goal. So with this bill and that common platform, does that mean we've achieved that and we've succeeded, and that the number of people whose courses get rejected when under normal circumstances it should be received, if the receiving institution credit was blacked out and no one could read it, that it would be accepted? I just want to understand the implications of the language in this bill.
Sure, and you will probably get different answers depending on who you ask this question. That might be a 3.0 version of this, but the fact is what was happening last year with the Transfer for Success Act, really put in a component of transparency into the transfer process. Now, MHEC is still promulgating the regulations through and has not fully passed them, but in that legislation last year, and the regs that MHEC is moving forward, there is this 70% rule, which will address some of the issues that you talk about. So that math course, if it meets 70% of the outcomes, it cannot be denied for transfer, which is one aspect, regardless of the number. So we're looking at more of the outcomes of each course or the curriculum of each course, making sure that they align. But you're right, there's still a broad array of different criteria in some of these courses across the state that do not align. But this 70% rule, hopefully, will help tremendously. And once that gets implemented, we'll see a little bit more what that looks like.
And the platform is designed to ensure that what the community colleges say are their courses and the four-year institutions say are the prerequisite courses, that is what the platform will show to the students. So the students will see exactly what they need to take for any given program, and therefore those courses will transfer. So.
Without question.
Without question.
Okay, so the number of appeals and complaints to the transfer office, we think will decrease and recede?
We think, yes, that is our goal.
Okay, and again, look, that MAC and USM is at the table together.
Yes.
Shows some progress. We have tried that many times to try to reduce and make it as seamless as possible and be less of an expense to students to take additional credits. So thank you.
And MICUA as well is in great support of this bill, and I want to give credit to MAC, the USM, and MICUA for coming together over the interim and really making progress here.
That concludes the hearing on the bill. Thank you for your patience and staying late, or relatively late. We're going to go to the Senator Lee, last bill of the day. This is primary and secondary education, Title IX, policies and procedures. We have Senator Lee. I see Ms. Jordan. I also have Adeline Flynn and Gia Grimm. If you'd come up, if there's space and you can distance your chairs a little bit. Other than that, I don't see any opposition to the bill, either oral or written. So we'll start and welcome Senator Lee to Education, Health, and Environmental Affairs.
Yeah, thank you, Mr. Chairman. This bill, SB 887, is just an update of Title IX policy to provide
Senator Lee, would you lean into the mic because it is being
certainly.
streamed, or
Yeah.
pull the mic closer or lean in, whatever.
I'll lean in. Is this okay now? Okay, great. Yeah, thank you. Okay, this bill, SB 887, is an update of the Title IX policy to provide students the tools to have their voices heard. There's a shocking number of sexual assault victims across the state in grades K through 12. So we're open to suggestions to improve the bill, but unfortunately the need for an updated policy in this space is very self-evident based on the cases and circumstances we are now seeing. Children should feel very confident to be able to report their abuse, to not only get services themselves, but prevent the abuser from moving on to the next target and then the next target. This legislation will hopefully help combat sexual misconduct in our schools with a proactive approach. Too often coercive relationships are developed in schools settings and they go unreported because there's such a fear of reprisal, embarrassment, or just a misunderstanding of what reasonable conduct may comprise of. The bill simply requires the Maryland State Department of Education to develop a database for administrators to upload sexual misconduct complaints. Then a public school just notifies the parent or guardian of a student who files a complaint. They collect data on sexual misconduct complaints and reports the data to the Maryland Department of Education. And finally informed students, faculty, and staff regarding who serves as the Title IX coordinator for the school and how to file a sexual misconduct complaint. The persons who are aggrieved can file a cause of action if the school system fails to comply. We are very open to friendly amendments to confront some of the concerns that may be raised, which we had during the House hearing. If a student has an unsupportive parent and there's a significant risk of harm to the student from notifying a parent of a complaint related to his sexual misconduct, the school may provide notification to another responsible professional or an adult to facilitate parental involvement. Of course, this is just potential language for an amendment that I will let our wonderful advocates here discuss with you directly. The main point is that we just want to encourage disclosure of sexual misconduct, even when students have legitimate concerns of what can be done about that info. For these reasons, we ask a favorable committee report on SB 887.
Okay, I think we're going to have all of you speak and then we'll ask questions. So you may proceed in whatever order you choose.
Hello, everyone. Dear Chair Pinsky, Vice Chair, and members of the Education, Health, and Environmental Affairs Committee. My name is Gia Grimm, and I'm a survivor and child advocate, and I support SB 887. When I was in elementary school, I reported a teacher for inappropriate touching. I reported to another trusted teacher. My trusted teacher took me to the principal's office, and I reported it again to the principal. The administration's solution was to have a meeting between me and the teacher that I had reported. I was walked down to his classroom. I sat in his classroom and listened to him tell me that I misinterpreted his touch and that he was sorry. My elementary school never told my parents that I had reported a teacher. I was not the only student who was touched by this teacher. However, as we all got older and moved on to middle school, he stayed. He taught countless children. He touched countless children. Everybody knew, but nobody did anything about it. About 10 years later, in 2015, I ran into the teacher that I had reported. He looked me up and down and said, "Gia Grimm, didn't you turn out pretty?" I stood there frozen. I felt like I was 8 years old again. I couldn't speak, and I had lost my voice. But it's now 2022, and I've reclaimed my voice. The lack of uniformity, transparency, and accountability of current Title IX sexual misconduct procedures and practices in K-12 schools leave students vulnerable to sexual misconduct by teachers, staff, and administrators. Our students need you, legislators, to provide them with the tools to be able to use their voices. Our past does not define us, but it sure does motivate us. I urge you to give SB 887 a favorable vote and to hear our voices. Thank you.
Thank you, Ms. Grimm, for your testimony. Obviously, I think we're saddened by what happened, but we're glad you're here. Next, please, either Ms. Flynn or Ms. Jordan.
Good afternoon, Chairman. My name is Addie Flynn. I'm a junior at Marriotts Ridge High School, and I'm here to request a favorable review of Senate Bill 887. For young girls who have been sexually harassed or assaulted in school, it is too late. It's just too late for them. Even if they seek justice and succeed, even if they send their abuser away for a long time, it's too late. For them, the pain has already been felt, and for them, the trauma has already been experienced. For them, their lives have already been changed. They are now more likely to drop out of school, to abuse drugs and or alcohol, to suffer from long-term mental health concerns, and the list goes on. It is too late for her, but it's not too late for the next victim. According to the Coalition Against Sexual Assault, child abusers have an average of 76 victims. And from one victim to the next, offenders are more and more likely to escalate to more serious crimes. I have seen the need for this bill in my school. When I first heard about this bill, I didn't even know what a Title IX coordinator was. I asked many of my friends if they knew who they would go to if they were harassed or assaulted at school, and not one of them knew. They didn't even know what their first steps needed to be. Sexual assault is the most underreported crime in the United States, so we should be making it as easy as possible to report. The standardization of the process for identifying, recording, and managing sexual harassment and assault complaints takes pressure off of school administrations, eliminates confusion, and protects students. It would establish a culture where students feel supported and are more comfortable knowing there is a process that protects them and prevents presently ill-equipped educators from mishandling their report. Having a well-established and publicized process protects everyone. If this bill is implemented in our schools, then we would be committing to creating a culture where abusers can be stopped after victim 1, not victim 9 or 10. By requiring schools to have a standard system to handle reports of harassment and abuse, we are potentially saving victims 2 through 76. We simply cannot afford not to implement this bill, or else it'll be too late for those girls too. Thank you.
Thank you. Ms. Jordan.
Thank you, Mr. Chair. Good afternoon, Mr. Chair, Madam Vice Chair, members of the committee. I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. We're here in support also of Senate Bill 887 and do have a suggested friendly amendment. I want to thank Senator Lee for her continued work in this area, but especially thank the young women to my left and Ms. Grimm especially for bringing her story forward. The Maryland Coalition Against Sexual Assault includes the Sexual Assault Legal Institute. It was founded in 2003, and when it was founded, we fully expected that college students would come forward and report sexual assault. We were shocked, however, at how many cases we get that are girls and boys between K through 12. So let me tell you about 2 of our cases. A first-grade boy repeatedly lured into the bathroom, forced to expose himself, and molested by the same group of boys over and over again. When his parents told the school about it, it was written off as bullying. If instead it had proceeded under Title IX, it would have been investigated. The little boy would have had accommodations to protect him, and when those parents requested a transfer, Title IX would have encouraged that transfer, which was denied. Another case involved a middle school girl raped on campus who had the bravery to come forward and report the rape. She was suspended for 10 days. There was no investigation as required by Title IX, and Title IX also forbids that sort of retaliation. This is a problem throughout Maryland. The most recent Department of Education figures we have are that in 2015 to 2016, Maryland ranked number 4 in K through 12 rapes, and then in 2016 to 2017, we're number 1 in rapes in school K through 12. The suggested amendment we have is just to accommodate that situation, maybe a gay child, maybe a child who is in a culture where they're not supportive. We just want to say if the child's going to be harmed, if we tell the parent there is another professional, another adult who you can reach out to, report first, and then facilitate how to involve that parent. Very child-centered, but also very protective of the parents. Title IX is an important federal law. We are not enforcing it properly in K through 12 in Maryland. And so for those reasons, we ask that you pass Senate Bill 887 with amendments so these survivors' voices can be heard.
Thank you. Questions for the panel? Vice Chair.
Senator Lee, Ms. Jordan, young women, thank you so much for being here. Thank you for your testimony. Senator Lee, thank you for this bill. And I'm sorry I was in budget and taxation, so I missed the very beginning. Did any of you indicate whether this is similar to or identical to anything that's happening in other states? Can you just give us any perspective on that?
You know, I don't know the full extent of this. I do know this is part of a national effort. Came from Delegate Lewis, and he learned of it through his work in Washington. So I believe that there are attempts to pass similar laws. I don't know that any have been implemented in a way that I could tell you how it's going.
Since you used the pronoun he, you're talking about Delegate Jazz Lewis, not Delegate Karen Lewis.
Oh, I'm sorry.
Young.
Yes, I am talking about Delegate
Very
Jazz
good.
Lewis.
Okay,
Yes.
perfect. Thank you. Thank you, Mr. Chair.
Senator Washington.
Thank you for this bill. I was interested to hear about the suspensions because I was looking at the suspensions data, and in 2019 we had 533 suspensions based on sexual harassment and 484 for sexual activity. And then there was about 1,400 on bullying and harassment. So those are like some of the biggest things, besides actually the 2 biggest are disruption and disrespect. But so what you're saying is that we don't look for Title IX, we don't treat these as a Title IX violation we just, how do we currently treat, I guess, how do we currently treat, and this is just student to student, so we're not even, so I don't know how we're collecting it with, if it's an adult and a child.
Yeah, I mean, what we are finding over and over again is that when we do have a sexual assault against the student, it's being miscategorized as sexual activity in school. So this case involved a young woman who had been suspended. Another case comes to mind where they placed a notation on the victim's permanent record that she had, quote, been involved in sexual activity.
Oh, I see.
And then we had to have that removed from her record. So Title IX requires an investigation, and that's why we really believe that better enforcement of Title IX would be helpful, because there'd be an investigation, not kind of this brief discussion and categorization as, oh, you must have just been having sex in the bathroom.
And then what's the trigger? Just the active, so in these, so all of this, potentially, it looks like any of these sexual attacks, sexual harassment, or sexual activity, would they be subject to a Title IX? I'm trying to.
Well, I think that's exactly what the bill is trying
Right,
to address, is
Okay.
that school systems, they often have one Title IX coordinator for several different schools or for the entire school system,
Right.
so students don't even know where to go. So say you have a young boy, he's been sexually assaulted, and they're just saying, oh, this was sexual activity, he doesn't even know who to reach out to.
Got you.
And so this would allow us to have someone to reach out to, and it would also provide us with data so we really know what's going on. This committee has done a really fine job of moving things along at the college level, where we're having better enforcement. So kind of similar to Senator Kagan's question, it's really extending that down into K through 12, where we also desperately need it.
Yeah, and again, to our panelists, thank you so much for standing up. A few years ago, some women in our own house, our House and Senate, had to stand up for all of us to get some things changed. So, you know, even as adult women, we're fighting this as well, and boys, and of course. So again, thank you for your, for your courage in doing this. And again, thank you, Senator, for bringing this to us.
Thank you, and thank you to the sponsor and to all the panelists for bringing this bill forward. I was just curious, along the same line of Senator Kagan, the Vice Chair's question, what are we doing in terms of tracking at the college level? And does this follow, is this like modeled on exactly what they do, or is it slightly different?
Yeah, it is different than what they do at the college level, because the college level is much more heavily regulated by the federal government, and in fact, we're expecting some additional changes to the regulation. The prior administration in Washington changed those college-level sexual assault investigation regulations, and now the current administration is expected to refine them yet again. So it is significantly different. At the college level, you have a right, both parties have a right to an attorney, and there's some very, very detailed procedural requirements, both in state law and in federal regulation.
If you're able to follow up with any brief explainer about that, I think it would be helpful. Thank you so much.
Yep.
And finally, I want to go back to something, and I don't know if it's a sponsor or one of you referred to, the language about notifying the parent or guardian. And I'm not sure if that's where one of the amendments would fall in. But I guess I have two questions regarding that. When the young person comes in to report it, are they told or asked whether the school and the coordinator can in fact notify the parent or guardian? And if they say no, does that mean they walk away? I'm just trying to understand, for those very reasons, again, one of you mentioned that for whatever reason, the parent won't understand, or if it was another student rather than a teacher, they don't want to get them in trouble, but they want it on record, whatever the reason. I mean, how do we clean that up to make it where it's a safe space for the student and they're not getting into a situation that they didn't intend to get into? And again, we don't want to dissuade them, but also their eyes have to be open. So
Yes, thank you, Mr. Chair. I really appreciate the question, and I also appreciate your concern about the students kind of knowing the implications of what's going on. The suggested amendment that we have is on page 2 of MCASA's testimony, saying that if there is a significant risk of harm to the student from notifying a parent of a complaint related to sexual misconduct, the school may provide notification to another responsible professional or adult to facilitate parental involvement. So that would be the suggested statutory language. But if you look at the bill itself on page 2 at lines 20 through 21, the state board is also expected to adopt some regulations. And so I would anticipate that they would have some more refined and more detailed information there. Certainly, we do want children to know what's going to happen if they report, and we don't want to discourage them from that. And we also want to make sure that all kids are really supported and not put into a more dangerous situation if they report sexual misconduct of others.
Right. But you do expect that the student will be told that
Yes.
it'll be shared.
Yes,
And again, we hope it doesn't dissuade them, but they need to know because there could be a shock at home and they need to be mentally and emotionally prepared. So I don't know if that's in the bill or you assume that'll be in the regulations or it might be in the amendment, you know.
I think any of those things are possibilities, but I would expect that sort of detailed information about what exactly you're going to do when a student comes forward would be in the regulations.
Okay. Thank you. Seeing no further questions and no opposition on the testimony list, thank all of you for your patience and your willingness to come forward and share your experiences with the committee. Thank you all. Okay, committee, that's our last bill of the day. We are not voting today. We're actually, this is the earliest in multiple weeks. We've ended. Tomorrow, you will, if your office hasn't already received your voting list, there is one for tomorrow. I don't know how many bills we have. I think it's probably between 8 and 12 or 13. So that's the plan for tomorrow. Friday is alcohol day. Not to drink, but to listen. We may do some voting afterwards, depending how long it takes. I will try not to keep folks late. So we'll also have to see how we do tomorrow. Okay. Climate bill.
Are we working on that?
Well, you know, the temperature has gotten a little hot. And we're trying to look at some climate resolution. No, I mean, look, it could be Friday. I'm not keeping things from you. We're just trying to get to a point where we have a bill that does something, and I will alert you and hopefully get out any amendments at least the night before. So it won't be tomorrow. Could it be Friday? Yeah, but you'll know tomorrow afternoon.
I'm trying to find out what day so I can manage the expectations at home on what time I might
Right.
be back. And there's no problem, I just have to manage.
Well, and in fact, we don't know what the language will be. It might not be a multi-hour conversation.
Just say yes to everything and we'll be out of here fast.
Yeah, that's not what I meant, but anyway, thank you. We're adjourned. Thank you. Be safe. Be safe.